All right, good morning. Welcome to the second week of the Joint Appropriations Committee budget hearings. It is Monday, December 18th. We are starting right at 8:01. We'll begin the morning with roll call.
Representative Henderson. Representative Larson. Here. Representative Sherwood. Representative Stith. Representative Walters. Here. Representative Zwanitzer Dave. Here. Senator Anderson. Here. Senator Guru.
He'll be joining us later on Zoom.
Senator Kinski. Senator Salazar. Co-Chairman Nicholas. Madam Chairman.
Here.
Madam Chairman, you have a quorum.
Thank you so much. All right, well, bright and early, we're starting off with the Wyoming Military Department, and we have with us this morning the Adjutant General, Major General Greg Porter. Welcome.
Hey, good morning, Chairman. How are you?
Good. How are you doing?
Good, ma'am. Good, ma'am. To Chairman Nethercott, Chairman Nicholas, members of the committee, if you'd like to follow along very quickly, my intent was to give a quick military update of what's going on with the military department and then go through by exception if that pleases the committee, if that works all right.
Sounds great.
All right. There is a set of slides that this is what the cover page looks like. I'll just jump right into it if that's all right. For the record, my name is Major General Greg Porter, and I do serve as the Adjutant General for the state of Wyoming. Thank you all for taking the time. I know it's a busy holiday season, and I know this is your job, but still appreciate you doing the work of Wyoming for all of us. Thanks very much. Let me start with slide 2 and just try to give you a sense of what's going on in the military department since we last talked. So mobilizations are really starting to kick up again. I know we don't, you don't hear that much about the in the news, but you do see that it's a dangerous world out there, and the Wyoming National Guard is certainly part of that. Very quickly on the Air Guard side, my priority still is achieving in strength and building cohesive teams so we can get after the mission of fighting and winning our nation's wars and protecting the residents of those here in Wyoming. Our strength on the air side is right about 94% right now. We are starting to see a turn in recruiting on both services starting to go up. The referrals program is helping. We have 2 total paid out on the Air Guard side, but we've got some more pending. So that's working very well. Thank you very much for that. Our objective this year is really to get another 150 accessions on the Air Guard side, and we're well on that way with 27 so far. Air Guard deployments, we currently have 4 C-130 H-3 aircraft in the AFRICOM area of operation. They left right after Thanksgiving. They'll be over there anywhere, depending on what their mission, what their particular mission is, for 4 to 6 months. About 140 personnel. About the springtime, we'll send another 75 to 80 in that range, again, for another 6 months into the AFRICOM AOR. It's pretty busy. If you see the slide, you can see there's a circle around the country of Djibouti down there, around there next to the Red Sea. And again, they're doing a lot of, inter-theater lift between CENTCOM and AFRICOM. Wanted to try to give you a sense of really some of the incredible folks that we have on the Air Guard side. They just participated in Global Strike Challenge 2023. That's Global Strike Command's Security Forces competition. They took second overall, but we had some individual winners that were pretty cool. We had the best marksmanship trophy winner. We had the best M320 shooter, which is our grenade launcher, and we had the best sniper. All came home, and one of our folks is now a coach or will assist coaching the Global Strike team as they go up and compete against the rest of the Air Force's Security Forces Squadron. So some really outstanding airmen in our ranks with the Wyoming Air National Guard. Any questions on the Air National Guard quickly before I go?
Representative Larson.
Thank you, General Porter, for being here. But yeah, I just a little, when you talk about best sniper, best shooter, can you kind of give us an idea of what the competition and what that takes to do that? That sounds pretty significant to me.
Madam Chairman, through you to Representative Larson, it's a pretty significant event. They compete with all of the Global Strike bases, which is 20th Air Force, and Global Strike Command, which is everybody that's in Global Strike across. It's in California, New Mexico, North Dakota, Montana, Wyoming, the entire base. So they all go through a series of competitions. The sniper, for example, they'll try to make sure that they can sneak up on you and they can hit the targets. It's about 4 separate competitions. They come in and then they roll all the scores up at the end and get what you get. So they did a great job.
Pretty cool.
Yep, they were pretty proud of it too.
Representative Henderson.
Thank you, Madam Chairman. Good morning, General. Always good to see you. Appreciate what you do. So I have a couple of questions, just really clarifying update. You know, a year or so ago, we enacted a benefit for the Guard. Curious to know how many have taken advantage of that. And also would like an update on how many members of our Guard are from outside of Wyoming. You know,
General.
if you don't have the number now, later would be fine. Thank you.
Madam Chairman, Representative Henderson, on the air side for the referrals, we've got 2 that have completed, but 4, so six will be completed on this one. On the Army side, it'll be 11 here shortly. 8 have been paid out, and another 4 enlistments are coming in. I'll have to owe you on how many folks outside of the National Guard, Representative. I don't have that number.
Any further questions?
Madam Chairman,
Senator Anderson.
what did you say? How many people or planes do we have deployed right now?
Madam Chairman, Senator Anderson, 4 planes right now at about 137 personnel, just short of 140.
Thank you.
All right, go ahead.
Thank you, ma'am. If I flip to slide 3, we'll talk about the Air Guard, or the Army Guard, excuse me. As I said, on the referral side, we've got 11 about to pay out or completed on the referral program. Strength is at 92.4%, 38 out of 169, but we're really doing pretty well. We're the #1 small state in recruiting right now with where we're going on the sessions. So our focus is really starting to switch a little bit to the retention side, particularly as I'll talk to you about the deployments coming up. We do tend to have a higher attrition rate after deployments. That's just sort of the nature of the business. So we'll get after that as well. But again, referrals are working, providing leads to us on the Army side. As I said, on the Air Guard side, they're deploying right now, but the Army will start deploying here this July. So right after Frontier Days here in Cheyenne, we'll send a battalion of HIMARS launchers, 2nd to the 300th Field Artillery. They're headquartered out of Casper, but they've got units in Lander and Gillette and Douglas and across the state. We'll send that entire battalion, that's 16 HIMARS launchers. Those are our rockets, and they'll go into the Central Command area of operations. They'll take with them their forward support company, and it'll be a 9 months boots on ground, so almost a year by the time they go through their mobilization, which they're mobiling out of Fort Riley this year, and they get back. About 6 months after that, the 115th Field Artillery Brigade will deploy, and they'll take with them the 148th Forts or their signal company, also going into the Central Command AOR. Actually, they'll take over as the headquarters for 2nd to 300th. So we'll have about 1/3 of the Army deployed, of the Wyoming National Guard Army deployed in starting in about December of 24. So not our largest deployment, probably the 3rd largest that we've had over the last 22 years, but a pretty significant chunk of folks out. Again, we got some great folks in our ranks. So last year, you may remember, I told you that we had the #1 Army Guard National Guard Commission Officer of the Year. Well, this year they followed it up and they have the #1 Soldier of the Year, Specialist Harrison. So he competed both in the state and then regionally and then nationally and emerged as the #1 soldier. So very proud of the folks we have here. I think many of you know Sergeant Rebecca Bridger. She's a member of our 67th Army Band and also Miss Wyoming USA did a great job for us. And you may have heard her sing. She's outstanding. So some really awesome personnel in our ranks. Any questions before I go to the next page?
Madam Chairman,
Senator Anderson.
where is CENTCOM? Is that?
Yes, sir. So Central Command, you'll know that's where Kuwait, Jordan, Syria, that's that area of operations. They'll actually be doing what they call Operation Spartan Shield. It's a mission they've done before. So they'll see a lot of the same area that they've done in the past. Things are getting a little interesting over there, though, so I don't know if they'll be still in the same locations that they were the last time they deployed there, but it'll be Jordan, Syria, Qatar, Kuwait, UAE, spread across there, depending on what things look like.
Further questions? Go ahead.
All right, very quickly, on slide 4, I just wanted to talk a little bit about the Joint Staff. Had a very successful Vigilant Guard exercise this last summer. Really had first responders, military department, Wyoming Office of Homeland Security, members of the governor's office, really had a great exercise in June of last year. It was a very bad day in Wyoming. We tried to put as much pressure on all of us as possible. So we had floods, fires, mass shootings, tornadoes, train derailments, all kinds of things, just trying to get after some of our techniques and procedures and our standard operating procedures to just stress us, make sure that we can get after those things in protecting our residents. Very good exercise, probably a once, it's actually sponsored by Northern Command. And this is the first one we've done in probably 10 or 15 years. It's takes a lot of resources and a lot of time, and I want to once again thank all the first responders across the state that helped us exercise all those TTPs that we did. So it was very good. Veterans Commission really is doing a great job, focused on a couple of things here. We talk about the Governor's Challenge, which is a nationwide challenge with all the governors that sign up, really focusing on how do we do better in mental health for veterans? How do we do better at suicide prevention? How do we get after those things? So they're getting after that. Veteran suicide is going to be a focus for us going in this next biennium. Mr. Shepard is starting to shape things to get after that piece. And then he's really doing a pretty successful program called Veterans, talking to veterans. If folks have some questions about it, he can talk about that. But really doing a lot of work in training our veterans on how to talk to each other about what's going on in their lives. So a very good program. Dental care and rural transportation. Rural transportation is really taking some great strides, bless you. And we're doing really well there. Starbase. Starbase continues to be great. At the urging of Representative Larson, he asked that we try to get Starbase out away from Cheyenne. That's our permanent location, and the team really did a good job. And they went out this last summer and held 3 summer camps in Casper and Fort Washakie and Buffalo. It was wildly successful. They weren't, the team wasn't quite sure how this was going to go out, but they were pretty pleased about it when they got back. And so I think we'll continue to be doing this, and that was a great program. Those of you that aren't familiar with Starbase, it really gets after our elementary school kids along STEM programs. So they do a lot of robotics and engineering and that sort of thing. And it's pretty interesting for them. And it was a great one. So I appreciate that, Representative Larson. I think that's all I had in terms of a general update to the committee before we go on. Is there any questions that I can answer?
Questions for the general? All right, seeing none, let's get to your budget, governor's exceptions.
All right, I would like to introduce our Deputy Director, Mr. Doug Shope. He'll be the primary person walking through the budget, if that pleases the committee. And ma'am, is there any, you just want to go by right through by priority, or would you like just right through the budget book in order? Is that the best way?
I saw you provided in your meeting materials a summary of your exceptions. I didn't know if you wanted to go through that, but whatever you prefer to do and go through the budget book or that summary exception page.
If it's fine with you, Madam Chairman, I'll have him go through the exceptions. I was only able to really talk about the top 7 in this one, so in the read ahead, but we'll cover all of those if we can. So, Mr. Shope, please.
Good morning, Madam Chairman. Good morning, Madam Chairman and members of the committee. I'd like to jump to page 16, which is our roll-up of our priorities. I really don't want to brief much off of this. On page 17, the totals really don't tell the story. When you look at the very top, priority number 14 is removal of the budget for the challenge program. And so that kind of skews those numbers. Madam Chairman, I'd like to go to page 24 and just go through by page order. This is priority 3. Page 24. A general comment, the governor has recommended approval of all of our standard budgets, and so I won't be redundant in repeating those. So priority number 3 is for the funding for our benefits supervisor that was appropriated last session. And there is language that includes the intent of the legislature to continue the program, as well as including the support for the position, but the actual position salary, the language did not support that in the standard budget. And so we've requested the budget be approved for that position. And it is critical to manage our programs, our education assistance, our state active duty insurance premium program, our referral bonus program, military assistance, and the dependent care that tracks under military assistance, and responsible for all of our benefits databases. And then on page 26, the governor did recommend approval of priority number 3. Also on page 26 is priority number 4.
Representative Larson?
Thank you. So I'm just curious why you just didn't include it in your standard budget. That was the intent. Why are we making an exception request?
Madam Chairman, Representative Larson, the language in the statute did not reflect the intent of the legislature to do that.
What did it reflect, Mr. Shope?
So follow up.
Hold on.
So,
You-
Madam,
So
Representative
if the-
Larson, go ahead. He has a couple of questions coming at him, but go ahead, Representative Larson.
Okay. So if the intent of the legislature for the funding of the position should continue, and we're fine where we are, it's just, it's not a big deal. To me, as I look at your explanation, it just appears as though it could have just been put in your standard budget.
So why don't you think it could be in your standard budget based on the language of the statute?
because, Madam Chairman, Representative Larson, on page 25 are the 3 different sections straight out of the statute that I've copied into this request. And when you look at A, for example, it says it is the intent of the legislature that this appropriation be included, but that's the appropriation for the program, not for the position. And then the support costs in paragraph C, it specifically says that the intent of the legislature that 104,000 of this appropriation not be included, which would say that the remaining 5,000 for the support cost for the position would be. But in paragraph B of the set, it doesn't reflect the intent at all. And so when the intent was specifically called out in the other 2 line items, the assumption is made that there was no intent, even though we believe it was so.
There you have it. Any further questions, committee? All right, thank you for that explanation.
Madam Chairman, on page 26, priority number 4, grants and contract administration manager. This is what I'm calling the supervising contracting officer. This request is for a new position. This would be the senior contracting person in our agency. As you may or may not know, our agency has a significant number of contracts that we let during the year, with a high volume of those aimed at facilities, as well as benefits. And as we add more benefits, more contracting is also needed. This position is critical to our operation. However, on page 27, the governor has recommended denial of this position.
Representative Walters?
Thank you, Madam Chairman. And who is currently doing most of these duties? Because I'm guessing they're not going by the wayside. Somebody's handling them.
Madam Chairman, Representative Walters, I perform all of the senior level contracting responsibilities. I plan on retiring in 3.5 years. And right now, even though 3.5 years is a long time to hire a person to train, next biennium is too short. So we're in a time crunch to give me a substantial amount of time to try to train a person to do that job. And then we would have this 10-level position would be the contracting officer that would report to the person that replaces me, because the person that replaces me probably will not be a contracting specialist.
General?
Madam Chairman, Representative Walters and members of the committee, if I could just add on this, Mr. Shope's a little bit modest, but he does all this, but at the expense of himself. If you look, the hours he works, the leave he doesn't take, it's significant. And while it's true that, we're always looking to have somebody come in behind them and train them, it's really a need for us now. He spends a lot of time doing this. And as I said, more than 40 hours a week. I'd probably say 50 or 60. So it's a need. I wasn't successful in imparting that need to the governor, but it's critical for us. And I think it's only going to get more critical as these changes at the national level on state contracting and how we have to deal with that are going to continue. Ma'am.
Thank you. Questions from the committee? Seeing none, please continue.
Madam Chairman, on page 27 is priority number 6. This is our marketing funds and recruitment. It was recommended by the legislature that we go to the University of Wyoming and work with them. And we did so and developed a marketing, public relations, and communications plan. And the objective is to increase awareness of the Guard statewide, reflecting the tag's intent to focus all of our efforts around the sword and shield motto. We are in a state that is largely untouched by the Department of Defense recruiting, and we should be able to recruit more, but it is, again, getting the word out. And as you may or may not be aware, the youth are straying away from service in the military. So we need to encourage them to come back. And that's what this $159,000 is for. Madam Chairman, on page 28 is the governor's recommendation to approve this request. Madam Chairman, also on page 28 is priority number 8. And this is our standard computer and technology. Excuse me. This is a request for a computer and technology support specialist for our agency. Several years ago, when we consolidated all of our resources to ETS, we transferred 4 individuals to that organization, and we probably get 10 to 20 hours of service per month. And so that's a far cry from what we had. And we need somebody on the ground to support all of our automation efforts. Again, on page 29, the governor has recommended denial of this request. Madam Chairman, also on page 29 is priority number 9, and this is our primary budget for hardware and software replacement. We worked in detail with ETS to develop this request in the amount of $87,830. Madam Chairman, on page 30 is the governor's recommendation to approve this request. Madam Chairman, the next priority is on page 40. This is priority number 13. And this is to establish a new section in the state affairs for youth services. This was to establish 6 positions that would fundamentally replace our challenge program so that we could recruit 16 to 18-year-old high school dropouts and send them to challenge programs in other states. Madam Chairman, on page 42.
Mr. Shobes, the governor denied this, is that correct? Or that's where you're going?
Yes,
All right.
yes, Madam Chairman, on page 42, the governor did recommend denial of this request.
Why is this in your, why is this an exception request? Why is this here? General.
Madam Chairman, really, it was there were 2 parallel actions going on. The Joint Transportation Committee had undertaken a bill that would establish it. I also thought it was appropriate to put this in, to request it on the agency side as well, to make sure that if we were to continue the program, there wasn't any lapse in momentum or that sort of thing, particularly with our employees and that sort of, so that's why I put it in the budget request, ma'am.
In the event that effort doesn't move forward by the legislature, do you still want this type of program?
No, ma'am. Based on, when we put this in the budget, it was before we had finished with the stuff, with the work in joint transportation. So I think the governor made it pretty clear, and the legislature too, ma'am, on where they stand on it.
And you agree with the governor's position?
I'm sorry, ma'am.
You agree with the governor's position?
Yes, ma'am.
Thank you. Okay. Mr. Shobes, please proceed.
Madam Chairman, page 46. This is our Air National Guard budget, and priority number 2 on page 46, 47, and 48. You will see I've taken an excerpt from the report that is in the front of the budget request. We currently have a statute that allows us to create positions that are 100% federally reimbursed. And for the Air National Guard, we have 9 full-time positions or at-will contract positions that can be used. And we are currently using 7 of those positions. We have used this program and that statute for about 4 biennium. And so with that, the 7 people are almost permanent, but they're still treated differently because of that establishment. And on page 48, the governor has recommended approval of putting this footnote in the budget so that we can continue with those positions.
Madam Chairman,
Senator Anderson?
if I look back on page 16 at priority number 2, there's no dollars in there. Are those dollars in priority 3, or where are the dollars for this?
Madam Chairman, Senator Anderson, it took me a minute to get there. You're looking at the footnote. There are no dollars there because they're 100% federally reimbursed, and we D11 those positions into existence at the beginning of every biennium. And so in June, we submit that request to the governor's office for review, following if the legislature puts the footnote in the budget bill for us to continue that program.
Representative Larson?
Thank you. It appears that this has worked well, and it is, as the federal funds are available, then you have the flexibility in hand to do that. So you've got 7 of the 9 positions that are fully federally funded. Is 9 okay, or do you foresee that could maybe go past that, and should we adjust that amount, I guess is my question.
Madam Chairman, Representative Larson, at this time, we believe that it is sufficient. We've had the same 9 authorizations for the Air Guard since the inception of this statute. And so we've only used 7 in, going on 10 years now. So In the future, we may need more. These positions are virtually permanent. We have never quit any of the programs that we have initiated with these positions with federal dollars. And so it just gives us the flexibility to immediately hire a position if we need to through the B11 process. Madam Chairman, the next priority is on page 62. And this is our priority number 1. This is the same as the previous Air National Guard approval. This is the request for the Army National Guard. Again, since inception, we've had 13 positions, full-time positions or at-will contract positions that have been authorized. And to date, we have used 6 of those. Madam Chairman, and on page 64 is again the governor's recommendation to approve this footnote. Madam Chairman, the next exception request is on page 82. This is our priority number 7, and this is for a senior policy and planning analyst. This position will be the deputy director of the Veterans Commission and will specifically have responsibility to implement new programs. The mental health program, which is focused to spearhead initiatives for suicide prevention among veterans, a dental program, and a caregiver program.
Representative Larson.
So this goes back to the last 2, the Air Guard and the Army on those positions and in extending the footnote, and be a question to Dawn. So that'll show up as a footnote in this agency in the budget. Is there any value or anything of having that be a statutory to where we're not doing that? Is it okay doing it that way, or is there a better way to do that it doesn't have to come back each time, if I'm making any sense there?
Yes, Madam Chairman, Representative Larson. Under the current operation, it seems to me that the footnote is the best approach. If the military department identifies that, I believe you indicated that 6 of the positions had been used in the second footnote, and if those are going to remain permanent for a period of time, there might be some benefit of incorporating this authority within statute. However, under the current situation, it seems like it's fairly dynamic based on needs.
Thank you.
All right, thanks. Go ahead.
Madam Chairman, Representative Larson, I'd like to expand on that. Either program, if you go to page 62, the implementing legislation is 19.7.103 B22, and that legislation is very specific and says if you choose to put the footnote into the budget bill. So it's a simple matter of changing the statute if you choose to change the statute. Madam Chairman, on page 83, the governor has recommended approval of this senior policy and planning analyst. That would be a new position, deputy director for the Veterans Commission. Also, Madam Chairman, on page 83 is priority number 15. And this is an annual federal grant for our highly rural transportation program. And it has expanded significantly as word of mouth has gotten around the state. People want, veterans want transportation. to the veterans medical facilities. And so at the recommendation of the budget office, instead of doing this by B11, we have put in a $1 million request to accept those grant funds for that transportation program from the federal government.
Madam Chairman.
Senator Anderson?
That transportation, is that you actually furnishing a vehicle, or is that a reimbursement for a veteran to get to the VA facility?
Madam Chairman, Senator Anderson, I can't tell you the exact number, but we probably have 15 or 20 vendors that are private individuals that contract with us to pick up and drive veterans to their appointments. And Madam Chairman, on page 84, the governor has recommended approval of that request. Madam Chairman, the next request is on page 93, and this is our National Guard Museum here on Pershing Boulevard in Cheyenne. This request is for $64,000 to pay for contract services. Primarily, these contract services would be for retirees that would volunteer more of their time if they were paid a small stipend to come in. But this specific is for one person to have that responsibility to open up the museum for visitors.
Question.
Representative Swanitzer?
Thank you, Madam Chairman. I was over and visited the museum a couple of weeks ago, very impressed. My question is, it really appears to me that it's overgrown, that you need more square footage. Is there any plans coming up in the future for expansion or relocation? And
Madam Chairman, Representative Swanitzer, at this point, no, we recognize that need. Early on, we were hoping that we could possibly on the southwest corner of that property build a new facility where it's mostly parking area, gravel parking area. And probably into that compound even where we have military equipment displayed, and possibly even share a museum there with the base museum since it's difficult for civilians to get on base. So we would have, if we ever built that, we would have that available to the base. But right now, Representative Swanitzer, there are no plans to build that or expand that operation.
one quick follow-up.
Yes.
I was curious about the front door. It's a solid metal door. Is there a chance that like a double entry glass door, something that looks a little more inviting? I mean, it looked like I was going into the back of someone's warehouse, and I just curious for a few bucks if we could present it more as what it is, a place to be enjoyed.
Madam Chairman, Representative Swanitzer, yes, we can certainly take that into consideration and look at a project to do that.
Representative Larson?
Thank you, Madam Chairman. I'm just curious on visitation. How many visitors do you get annually?
Madam Chairman, Representative Larson, I'll have to take that as a due out and get back with you. I have no idea. I know we have a significant number of our youth from schools that come and tour the facility, and that is probably the highest population. Of course, when we have non-resident visitors, especially during Frontier Days, we get a lot more traffic through there, but I don't know the specific numbers.
And Madam Chairman, I bring that up as you contemplate perhaps an expansion or something. That kind of data will be helpful for us to help make that decision.
Representative Sherwood?
Thank you, Madam Chair. And thank you for the report out and the follow-up on working with the University of Wyoming on your marketing strategies. So I'll throw another suggestion out there. UW has a museum studies program. They are actively looking for internship experience-based opportunities for their students. And so I will happily put you in touch with them. I think this would be an amazing opportunity for a young person to come and see what they can do to support the operations of the museum.
Madam Chairman, Representative Sherwood, thank you for that.
Does the museum take donations?
Madam Chairman, yes, they do, but they do not really amount to much.
Is that through a foundation or what entity receives those donations? I'm sure it's de minimis, but
It
assuming that's
is a
bigger.
private nonprofit that is mainly run by the retirees. And again, we're talking maybe a few $100s for a whole year. So not significant.
But it could be.
It could be. It mostly pays for coffee for retirees that are donating their time to come down there and work. And that's, you know, it's that through that donation that the facility looks so good.
Well, it's glad to hear that there is an entity created. Oftentimes we see kind of these requests come forward and we're not quite that far along even to be in a position to accept private dollars in order to provide a public service. So.
And
that's
Madam
good
Chairman, we
news.
do have the capability to accept those within the agency if they were donated to us for very specific things. We have never accepted any funds for that. However, for example, the aircraft that is parked there, you know, a private retiree came in and had a contractor build the concrete pad with his private dollars. We allowed him to do that because it was more cost effective to do it that way.
Great, thank you.
Madam Chairman, on page 94, the governor has recommended approval of this request. Madam Chairman, on page 98 is priority number 5. And this has been a topic of discussion for several decades. This is a building and ground supervisor that would be the new cemetery director up in Evansville. When we received the cemetery from our sister agency, we received one position in the 90s, and they had 3 that were operating prior to our receipt of that program. We have been able to get 2 over the past decades, but we are asking for a cemetery director that would more focus on all of the administrative tasks as it relates to dealing with the bureaucracy at the Veterans Administration, as well as dealing with all of our veterans within the state that have thoughts on things that should happen there and to make it a better place. And so that person would still be classified as a building and grounds and still be responsible for all of those type items and being able to train the staff that is there. However, again, their focus would not be in the building and grounds arena so much as it would be in the administrative tasks. And we significantly need that. You know, as an example, the current employee that performs as best he can those administrative tasks, you know, you can see him in coveralls out working on the ground, and he peels off his coveralls and he has a suit underneath so that he can go assist with services. And so that's kind of the example of why it is very critical that we have.
Representative Swanitzer?
Thank you, Madam Chairman. The Veterans Commission, what involvement do they have as far as the burial procedures?
Madam Chairman, Representative Swanitzer, the Veterans Commission provides all of the oversight to that program. And so everything that occurs at the cemetery is under the purview of the Veterans Commission.
My grandparents are there. We got to take good care of it.
Madam Chairman.
Representative Walters?
Thank you, Madam Chairman. While we're on the Veterans Cemetery, You're showing on page 98 expenditures of about 100,000, and yet on 101, you're only showing 21,000 there. Do we need to increase that to avoid B11, the need for a B11 throughout the biennium?
Mr. Schopp?
Madam Chairman, Representative Walters, our preference would be not to do that. We only want to move the amount of money by B11 that is needed at the time. And so if you advance an appropriation to us and we don't use it, then that just becomes more cumbersome in the accounting world. We can definitely do that. But again, we would prefer to leave it at this level, and if we use it, do it through the B11 process. But that would be totally up to you. And Madam Chairman, on page 99, the governor did recommend this position for the cemetery.
Representative Larson?
Clear again, there's 2 current employees. This adds 1, brings it up to get the 3rd, right?
Madam Chairman, Representative Larson, yes, there are. And we also, as a caveat, we also hire from a labor company, additional ground services for our lower end activities. And so we may have 1 person on approximately half-time, especially during the summer when the mowing is most prevalent.
All right.
Madam Chairman, the next request is on page 105. This is our priority 11. And this is for military training and non-emergent missions. This request for $10,100 is for anticipated exercises that we intend to expand with other agencies and entities in city and county government regarding our emergency response. And it coordinates, it does tabletop exercises and so forth so that we can coordinate our response statewide. Madam Chairman, on page 106, the governor has recommended approval of this request. Madam Chairman, the next request is on page 109, and this is our final request in the book, and this is priority number 12, and this is for Civil Air Patrol FLIR maintenance. And so that is forward-looking infrared equipment that is mounted on those Cessna aircraft, on 2 of the Cessna aircraft. You did pay for that equipment to be installed, and during budget reductions over the last decade, we've lost some of that money. We're trying to add that back in, and so this request is for $8,230 so that we can perform deferred maintenance on those 2 FLIR devices to keep them operational. And the criticality of this, and the reason we installed them in the first place, is because of the cost per hour to fly a Cessna is significantly less than launching one of our helicopters that have a FLIR device on it, probably to the tune of about 20 times more expensive, if not more, to launch UH-60. And so with that, the governor has recommended approval on page 110 of that $8,230. And with that, Madam Chairman, that concludes all of our exception requests.
Madam Chairman?
Representative Walters?
Thank you, Madam Chairman. On that request, the governor listed it as an ongoing. Should that be one time, since this seems to be one-time maintenance and then requested next time as it changes?
Madam Chairman, Representative Walters, it truly needs to be ongoing because that equipment should be under constant maintenance to keep it active. And again, it is very critical, especially up in the northwestern part of the state in the mountains where we have hikers and so forth. You have to have that infrared to be able to see through the forest canopy.
Representative Larson?
I hear what you're saying and I understand, but I guess my question was, is this is to make up for deferred maintenance, so the 8,000 would probably be a little, we'd expect that to be more because we're catching up. But is the ongoing 8,000 necessary? And I know we're not talking about a huge amount of money. I'm just trying to get my mind. So once we get caught up, is it 8,000 a year or would we expect that to be a little bit?
Madam
less?
Chairman, Representative Larson, no, this is 8,000 that will reoccur on a biennial basis. The original appropriation that we had to service these devices was $32,000 per biennial. And that was a budget number that was in the neighborhood of 12 years ago, if not longer. And so that cost has significantly went up. We have just gotten to a critical point that we add back in a minor amount of money to help us. We're still augmenting that with our existing budget in order to make that happen.
Thank you.
Senator Anderson?
I've got the answer.
All right, any final questions for the military department? Seeing none, final comments from Representative Walters.
Thank you, Madam Chair. I apologize for the late jumping in here. In your early comments, or in your early narrative, it discusses one of your challenges is major maintenance to your facilities. You receive, my research shows you receive approximately $6 million a year in major maintenance dollars. What more can the state do to make sure you're doing an adequate job maintaining those facilities? I know many of them are paid for with federal dollars and the state comes in to do the maintenance and whatnot. Is it a timing issue of the funding? Do you, or what can we do to better assist? Because we don't want to see our facilities fall into disrepair because that's the most expensive option.
Madam Chairman, Representative Walters, at this point, I think that the amount of dollars that are appropriated in major maintenance are sufficient for our needs. Execution of those dollars is critical, and sometimes those funds don't align, especially at armories where we need to have 50-50 matching dollars. And so if you have a sufficient amount of those funds on the state side appropriated and we don't have sufficient amount of federal dollars for anything specific, then we can't execute it. And so any project that we do at an armory, for example, is 50-50. And when we look at it, that's a dollar for dollar match. So it's not, we don't try to use a portion over here and a portion over there.
Oh,
So, thank you, Madam Chair. So if we front the 100% of the cost, can we be reimbursed for it so that the activities take place in a timely manner? Still ending up at the end of the project in a 50-50 match situation, but to better, as you say, align the dollars and get the projects done more efficiently.
Madam Chairman, Representative Walters, that is a possibility. We have performed that one time. We did a major overhaul to our United States Property and Fiscal Office warehouse in Camp Guernsey to the tune of about $1.2 million, and we used 100% state resources from the major maintenance account in order to rebuild that. That facility needed to be replaced about 60 years ago. And we've just kept adding to it and adding to it. We did a major rebuild on all of the electrical systems and lighting systems and everything for that facility a year and a half ago now. But that's the only project that we've performed at 100%. And if you choose to go down that road, you're probably not going to get reimbursed by the federal government if they didn't authorize that project from the beginning. Again, working under a cooperative agreement as opposed to a federal grant, it's micromanaged up to the National Guard Bureau level. And so projects, even minor projects that are only $1 or $2 million have to be approved by National Guard Bureau. And if the federal funds are not available, which is usually their driving factor, because they recognize that a project is needed, but if it's not a high enough priority to fund, then they won't authorize it. And if we move forward with that with 100% state funding, it won't be reimbursed.
Representative Henderson?
Thank you, Madam Chairman. So building on that, what are some highlights over the next, say, 4 or 5 years related to Camp Guernsey and these projects, particularly with regard to the concerns expressed in your budget?
General?
Maybe I'll, Madam Chairman, Representative Henderson, if I understand you correctly, I think you're asking for some highlights. Up at Camp Guernsey, we're putting quite a bit of resources into that infrastructure wise. You may recall that there's currently a barracks project going on there right now. We'll extend our bedding capacity. Probably the next biggest one that's coming up though is the fire station and air traffic control center, which was a congressional ad by the director that will start in 26. So we've got a lot of where it's currently located. The air traffic control center is not in the right place for some safety zones. And we've got a lot of fire equipment, crash rescue equipment that we can't put undercover. This will help us solve that problem going forward. That's probably off the top of my head, probably the 2 biggest ones. We do have a couple of barracks projects on the military, on what they call the Future Years Defense Program, the FIDEP. Haven't seen them be completely funded yet, so I don't know where that's going.
Representative Larson, we are 15 minutes behind schedule. Representative Larson?
Try and make it 17. So I'd like to just make sure I understand this conversation that you're having with Representative Walders. Are you saying then if the Guard approves a project, if the feds approve a project, the funding is then available in getting the funds to line up with major maintenance funds in those projects are not a problem? It's when they aren't approved that is where the problem is. Am I understanding that accurately?
Madam Chairman, Representative Larson, that's correct.
One follow-up, trying to better understand this, Madam Chairman.
Final comments from the general on your budget?
Yes, ma'am. Just wanted to cover very quickly some of the due outs. I think I owe you, I believe Representative Henderson asked for the numbers of Guard outside the state, provide that. The visitation numbers for Representative Larson. I believe Representative Sherwood is going to provide me some information on museum studies, and so we'll get that. And then lastly, Representative Swanitzer brought up about a project to make the museum more inviting, so we'll take a look at that. I will just close with, it is continued to be a dangerous world out there, and you ought to be extremely proud of your National Guard force. Those folks continue to do their civilian jobs and yet respond to the needs of the state and nation, and they're just an incredible group of people. I want to thank all of you for your support to those folks. You have been an example of support in terms of benefits for our folks, education being the most important of those, and the referral program, our childcare. Virtually every time we come and ask for something that helps our members out, you have stepped up. So I just wanted to thank you for that, and on behalf of all the men and women that serve in the National Guard. I think that's all I have. I can stand for any final questions, ma'am, but wishing you all happy holidays and Merry Christmas, and thank you for all you do.
Thank you, General. It's good to see you. Thank you for all you do in the military department. Happy holidays to you. Thank you. And with that, committee, we're going to go to one of our largest agenda items for the day. So we will get ready to dig in and start with the Department of Family Services. We will allow a couple of minutes here to pass as we exchange agencies. No break. There is no break. There'll be a 10 o'clock break pursuant to your agenda. Director Johansson, welcome. Did I say Department of Family Services? Did I say Department of Family Services? No, nobody's listening. We are proceeding on with our next agenda. We are with the Department of Health. Please take all of your conversations outside. We have a busy day. We're 15 minutes late. We're going to be on time and under budget, just like the Department of Health. Director Johansson, good to see you here this morning. I see you have with you your Chief Financial Officer, Mr. McVicker. Welcome. Welcome to the Joint Appropriations Committee. If you could please proceed and start with your budget.
Thank you, Madam Chairman, Mr. Co-Chair, members of the committee, Stephen Johansson, Director of the Wyoming Department of Health. Just a few brief introductory comments and we'll dive right into our budget book. My goal today is to be done before lunch. Hopefully we can hit that target and save you a little bit of time. Joining me today to my right, I have Eric McVicker, our Chief Financial Officer. Also in the room, just to introduce you to some of my senior staff, Lee Grossman is our relatively new state Medicaid agent in the Healthcare Financing Division. Matt Petrie, Senior Administrator of our Behavioral Health Division. Stephanie Pyle, Senior Administrator of our Public Health Division. Franz Fuchs, who you all probably know, our Chief Policy and Data Analyst. David Robinson, Policy Administrator in Director's Office. Also joining us and at your discretion, if we get into some details or need some technical questions answered, we have Jesse Springer, our Deputy Administrator of the Healthcare Financing Division in Medicaid. Reagan Latham, Operations Administrator in Behavioral Health. Jeff Clark with our Aging Division, Community Living section. And then throughout the day, as we get into our Public Health Division, we'll have our State Health Officer, Dr. Allie Harris, and our Wyoming Public Health Lab Administrator, Dr. Joseph Reed, should you have questions for them. As I mentioned, Madam Chairman, I'll be fielding and answering most of your questions, but with your permission, we'll rely on those folks if needed to provide additional detail or additional context. Members of the committee, Department of Health has somewhat of a unique budget this year. Much of what we'll discuss today is really rooted in actions that have been taken by the legislature in the last 3 to 4 years with the Department of Health's budget. Very little of our request for the 25-26 budget is what I would call new funding items or programming. And accordingly, in your materials, we prepared a simple summary document, just a couple of pages that you should have. We won't spend a whole lot of time on that, but because of some of the interactions of decisions that have been made over the past 2 biennia, we collapsed our entire budget request, our exception request, into 4 categories. The first one is what I'm calling stayed cuts or delayed budget reductions. These were step 2 and step 3 reductions from 2021 that were proposed, but some of them the legislature directed the department not to implement those budget reductions. The funding was restored, but it was restored on a one-time basis, whether through a general fund, Department of Health reversions, or the ability to leverage federal funds during the pandemic. There are a variety of mostly step 3 budget reductions that had the funding restored by the legislature, but again, on a one-time basis. That total, out of the $121 million that we requested, 43.7 million of our exception requests are in those stayed or delayed budget reductions. The takeaway there, members of the committee, as we discuss those exception requests, is that should action or funding not be provided in those exception requests, those previously proposed step 3 and 1 step 2 reduction would take effect on July 1st of next year. Second category, and this is all on table 2 of that summary document that you have in front of you. The second category that I collapsed these into are what I'm referring to as mandatory requests. Not to sound or be threatening that we absolutely have to have these, but mandatory in the sense that the Department of Health is either legally or operationally required to bring those requests to you. Things like our developmental preschool external cost adjustment. The department is required to bring the current ECA for the preschools as well as all historically unfunded ECAs. So again, mandatory requirement for the department to bring that to your attention. In addition, those mandatory requests would also include federal match issues. As many of you will remember, over the years, the state and all states benefited from an enhanced federal match in our Kid Care CHIP program. Over the years, that per congressional action, that federal match rate has ratcheted down. And so again, a mandatory request in the sense that we need to notify the legislature of that reducing federal match rate and what the general fund impact would be. That total in mandatory request is approximately $46.9 million out of our $120 million budget request. The third category, very similar to the first in the stayed budget cuts or stayed delayed budget reductions, is what we're calling maintaining funding. These are all similar one-time funding issues, like I mentioned, related to our Step 3 and Step 2 budget reductions, but not directly related to actual cut proposals. There were certain items over the last two sessions that this committee and the legislature, services and reimbursements that you all funded, but with one-time money, largely from the use of ARPA funds or the use of Department of Health projected reversions. That term reversions will come up many times during our budget discussion today. And what that has been over the last 4 years is that the Department of Health was projecting over the past 2 biennia that we would come in under budget. Instead of sitting on that, finding ways to spend it, because of some of the unique needs we had with our Department of Health facilities, some of the unique situations we found ourselves in during the pandemic with Medicaid policy from the federal government, we saw an opportunity to bring our reversion projections to you all in the 21-22 biennium and then into the 23-24 biennium to say, we don't think we'll spend this money. We could reduce our exception request in those previous budgets should you elect to move in that direction. And in many cases, you did, funding services on a one-time basis with reversions. We were happy to do that, happy to partner with you, but as we've discussed over the past 4 legislative sessions and budget hearings with you all, there's always a time where that true up would need to happen should the department not have those projected reversions in the current biennium. So we'll discuss those first 3 categories. You can see out of our total budget requests do represent the lion's share of the $121 million the department requested. The additional requests are what I would call new items. Out of that total exception request general fund pot, our new requests total about a little over $7 million. So again, the lion's share really is in these budget cut discussions from the Step 2 and Step 3, some mandatory requests due to changes at the federal level or things like the Child Development Center ECA, and then those one-time funding issues related to ARPA and related to Department of Health reversions. You'll see, Madam Chairman, out of our $121 million general fund request, the governor has recommended $101 million. I worked heavily with him and his office to try to strike the right balance in the governor's recommendations, and the Department of Health, I think we're pleased with where we are in bringing something that does carry with it quite a bit of sticker shock. In a time where the intent was really not to add new funding and new programming, but really fix some of those one-time issues that we've had over the past 2 biennia. I won't spend any more time on the summary document, but just
Thank you, Madam Chairman. But Director Johansson, I just want to make sure that I'm understanding correctly. So on the restoration of the cuts that we made, when we done that, we had a wide variety of Steps 2 and Step 3. We only took a portion of those and brought back, I think we talked about mental health, resident and outpatient. We come back, funded those with federal funds or reversions. Those are the ones that we've anticipated coming back into the standard budget. But you still have a significant number of Step 2, Step 3 budget cuts made that we didn't one-time fund, that were never restored, and you are not bringing them forth for restoration in the standard budget as well. Now, is that correct?
Madam Chairman, Representative Larson, that is correct. And the cuts across step 2 and step 3 in the 2021 legislative session that were made and that have been made were over $100 million in general fund. I believe the total was 116 million in general fund with a corresponding federal fund amount. Those reductions are not being brought back here. What's being brought back in this budget request, to your point, are cuts that were proposed, but that this committee and the legislature ultimately said to the department, do not implement those cuts. Instead, we'll restore the funding on a one-time basis with direction to come back in this budget session to raise the issue again. So those previous cuts that were implemented across Medicaid, behavioral health, really across the whole department, have been made a couple of years ago, and those cuts are still on the books. Madam Chairman, before we dive right into the book, we did provide 2 other documents for you. One is a policy brief and budget brief on the Medicaid postpartum coverage extension. You all in the legislature passed a bill extending coverage for pregnant women postpartum from 60 days to 12 months. We've provided a brief for you on what that would cost in the 25-26 budget to keep the funding going, and I'll address that towards the end of my budget presentation today. But suffice it to say, the law is on the books. The coverage will remain on July 1st of next year. What needs to be discussed is the ongoing funding for the postpartum coverage extension, and we'll get to that towards the end. This is one area that, with everything going on in the Department of Health's budget, all of the one-time funding issues, the unwinding that's going on with Medicaid eligibility following the pandemic, to be quite frank, I missed including the postpartum extension in our 25-26 budget and wanted to bring it to your attention. That's why you have a separate document that we want to present on and work with you on options for what that funding direction could look like. The third document, just to address very briefly, is a one-pager. I had just mentioned the Department of Health reversions that the Appropriations Committee and the legislature has used, and in my judgment has used wisely with the Department of Health's budget over the past 4 years to really see efficiencies where general fund exception requests could be reduced because the Department of Health had savings that we could deploy and you all could deploy in other areas. For the current biennium, we prepared a one-pager to show you our best guess with about 6 or 7 months left in the current biennium of where the department will come in with additional reversions from this biennium. This is in addition to all of the previous 19-20, 21-22, and 23-24 reversions that we've discussed previously. And you can see on the document, this is a Franz Fuchs special that you all have come to know and love. You can see our level of certainty on where we project our general fund reversions to be. We are pretty confident that the Department of Health this biennium will come in with an additional $20 to $30 million of general fund savings. And you can see how that cascades along our sort of range of uncertainty. 100% certain that we'll have at least 10 million. If you really want to go Las Vegas style, you can go down to $50 million of reversions, but we think that's less than a 10% probability. The reason I bring this up is because of all the interaction you'll see in our budget request as it relates to what has been used by the legislature to fund certain line items with Department of Health savings or Department of Health reversions. This is important for you all as you make decisions in some of our exception requests going forward in this true up, for lack of a better term, in the 25-26 biennium. But we want to be as transparent as possible with where we think we're going to be with our general fund position going into July 1st of next year when the new biennium starts.
Mr. Co-Chairman?
So I have a question. Kevin, is the governor's office going to bring a letter on the pardon?
Mr. Chairman, Erica Legursky, Senior Policy Advisor for Governor Gordon. That has not been a discussion of our letters, but I can take that back and bring that to them. That was not one of our proposed letters.
Well, we talked about declining letters. So
Thank you.
Director?
Madam Chairman, thank you. We'll dive straight into our budget book. Per the usual over the past several years, what I think has been helpful is we will start with our first division, which is the Director's Office, and just walk through our exception request. For your reference, in addition to the documents we provided, our priority table for exception requests, the summary table in the book, that begins on page 52. But our first division in the book is the Director's Office, and we'll start there, which is on page 69. So through the process, page 69. So through this presentation, Eric McVicker, our Chief Financial Officer, will bring your attention to the page number of the specific unit, whether or not that unit has an exception request, and if it does, we'll just go one by one with those exception requests. Madam Chair, if that's the will and purview of the committee.
Please proceed.
Madam Chair, members of the committee, we're on page 69. That's Unit 101. It's our Director's Office. In the Director's Office, we do have 2 exception requests. The first one you'll see on the bottom of page 69.
Madam Chairman, this is ETS, Technology Replacement Policy, or TRP. The grand total for this exception request is $356,000 of state general fund. This is for the department's normal and regular computer replacement program. Happy to answer any questions or provide detail on the breakdown of what that is for the department. These are one-time funds. Correct.
Madam Chair, a couple of places in the budget, I believe that we've have them all sorted out, but the tables are correct, but there's a couple of places where it says ongoing, and it should say one time. On page 70, this is one of those examples where it should have said one time when governor's rec. However, the tables are correct.
All right, thank you.
Madam Chair, moving on, the next exception request in the Director's Office is on page 70. This is tuition reimbursement and loan repayment for direct care staff in the department. This is a wish list item for me. You'll see it is prioritized relatively low. That's not because I don't believe this is important, but because, again, as we discussed in my introductory comments, this would fall into my additional request or new request category. Across our facilities, as you all heard when we were discussing phase 1 and phase 2 state employee compensation, the vast majority of Department of Health staff is located in our Department of Health facilities or field offices. So State Hospital, Life Resource Center, Veterans Home, the Wyoming Retirement Center and Basin. This year, and going back to 2022, I saw historic vacancy rates, primarily among nurses and CNAs. State Hospital in January reached a over 60% nurse vacancy rate. So very, very difficult recruitment. I could not be more pleased with the investment you all made in state employee compensation especially for those direct care workers, nurses, CNAs, et cetera. In addition, I have to commend A&I, Department of Administration and Information, over the past 2 years, and especially this year. They've really worked with us on our direct care attrition vacancy rates and recruiting through the phase 2 state employee compensation and through some other flexibilities. One of the flexibilities we use heavily, especially at the state hospital, is what we call educational leave. When a CNA wants to become a nurse, it's not something we pay for in their tuition or the school program, but we will hire them as a 40-hour-a-week CNA, have them work 20 hours. The remaining 20 hours is dedicated to their schooling, and essentially the goal is to get their nursing certification or their nursing degree. Then selfishly on the back end, when that happens, we will contract with them for 3, 4, or 5 years for service with the state hospital, with the Department of Health. And if that service isn't completed, that balance of time that we essentially gave them would have to be repaid back. This is a similar concept, but really the ability to pay for a CNA to become an RN or even an LPN. That's a lower level nurse that the educational costs are even cheaper. Again, this is something that would be new, but would be a tool that I would have in my toolbox, especially at the facilities and field offices, to provide upward mobility and educational support for our staff that are boots on the ground out in the field, providing these safety net services. The proposal here is to bring that money into the director's office as opposed to going directly to the facilities in those budget units or divisions, because we want to centralize and prioritize how that funding gets spent, really deployed in our most critical areas where we see the highest vacancy rates, to try to have a bit of a long-term strategy to educate those folks and build our own, so to speak. That's that exception request in a nutshell. Happy to answer any questions.
Representative Larson?
Director Johansson, I just want to refresh my memory and make sure that I'm accurate in the statement as you talk about this and coming back. So of this the largest budget that we have of state agencies, 90% is of these funds go out to pay for services to service providers, hospitals, DD providers, so on and so forth, for services provided to and businesses that provide services through the state. The remaining 10% that stays and is consumed internally with the Department of Health largely goes to these facilities. So the state hospital, the Life Resource Center, the retirement center, the Pioneer Home, those facilities then that provide services. And so you've got all the staff, but that's where most of that stays within the Department of Health goes.
Madam Chairman, Representative Larson, yes, the vast over 90% of all of Department of Health spending, as you mentioned, goes out in the form of reimbursements, grants, payments to providers, small businesses, hospitals, nursing homes, et cetera. Of the, let's call it 10%, that would be, Department of Health internal spending. The vast majority of that is paying for staffing and operational costs at our 5 facilities that you mentioned, and our field offices like public health nursing, WIC agencies, et cetera. A small portion of that is our Cheyenne workforce in our program. Not small, that's probably an overstatement, because we have 250, 300 staff here in Cheyenne, but the vast majority of the cost in the Department of Health for admin or overhead is facility-based staffing and operations.
Representative Henderson?
Thank you, Madam Chairman. Director, what's the average amount of a loan, and what's the average payback period?
Director?
Madam Chairman, Representative Henderson, I'll be honest, I don't have good numbers for you off the top of my head. It can vary. I will tell you that in general, if you have someone studying to get an LPN, which is a kind of lower level nursing certification or degree, I've seen educational costs there anywhere from $8,000 to $15,000 or $20,000. RN can be in that same range, but maybe on the higher end. But when you talk about other trades, we've had folks where we've looked at education costs to become a behavioral analyst, which is a new licensure that the state of Wyoming has. Those can really vary. But if this were to move forward, we'd be more than happy to prepare a briefing on the types of educational programs that our staff have pursued on their own and what those average costs would be. But it really depends on the school and the certificate program.
Director, I think this is a great idea. And I think if Hathaway had been structured this way, we would see more successful results coming out of the university by providing tuition reimbursement kind of both during and after it's been received. I think this is an important tool and will result in higher educational attainment and ultimately retention, because it sounds like the program, as you are anticipating it working within the department, is that upon each year of work, they get an additional reimbursement. Is that correct?
Madam Chairman, I think to answer your question simply, yes. We would want to combine this with the other tools or flexibilities we've had. For example, being able, and I've limited it to our most critical direct care workforce, to offer a one-time hiring bonus. That's been authorized by A&I, and we are not doing that across the board, but specifically with these positions. Secondly, to your point, looking at step pay with these types of not only experience with a couple of years, but certifications that someone receives, we want that to naturally correspond with the additional duties and the upward classification changes they would have in those positions. If I may, to add to what you said about retention, I agree. And in my 10 years in this agency, and especially over the past 3, being in this seat and seeing the incredible challenges we've had and the industry has had in health and human services to recruit, I know from that experience how folks become sticky in these positions. And it's not just salary, it's not just their base pay. I've seen more success when we build our own than when we try to recruit from out of state or other sectors of Wyoming's economy. And what I mean by that, I'll give you a few examples. Our current administrator of the Wyoming Retirement Center, she started with us years and years and years ago. I think she has a total of over 20 years with the facility. Started in housekeeping, worked in dietary, worked as a CNA, pursued a degree on her own, and once receiving that, worked in our medical records office, helped work in administration. Completed, which we encouraged, an administrator in training program a couple of years ago so that we could build our bench, not knowing how quickly we would need it based on a resignation. And now with our administrator at that facility, we have someone who came up for years, decades even, in that facility and is leading the facility. And it's one of the biggest success stories we have in the facilities in the Department of Health from the past year or two, which I hope continues. This is really rooted in that kind of idea, is to, yes, we need to look at salaries. Yes, we need to look at flexibilities and appropriate time and shift scheduling and differential. But in addition to that, folks will work in health and human services, work for the state of Wyoming safety net facilities more if they see that upward mobility and the kind of joining in them and investing in their career and in their future.
Thank you.
Madam Chairman, the next exception request in the director's office is on page 75. This is in our Vital Statistics Services, or VSS unit. And I will hand this one over to our CFO, Eric McVicker. It's relatively simple, but I'll let him explain this request.
Madam Chairman, members of the committee, what we'd like to do with Vital Statistics, we've tried to be as efficient as we could with the public and having access to getting records. So in the last few years, we've gone online. We allow credit card payments. In doing that, it's increased our operational costs a little bit with credit card charges and things like that. What this request is asking is for $500,000 in our general fund to increase that budget to cover some of those costs. On the flip side, we bring in a little bit over $1 million every year in fees in Vital Statistics. That money goes directly into the general fund coffers. There isn't a trust and agency account or anything. So I guess a way you could look at it is we'd like to keep $500,000 of the $1 million that we collect every year for operational costs, but would obviously stand for any questions from anyone.
All right, go ahead.
So moving on, that completes the director's office. We will be on page 81, and this will.
Representative Walters?
Backing up there briefly on that. Does your agency utilize the statewide credit card system? And then do you charge the user a fee for paying with the credit card as many of the other agencies do?
Madam Chairman, Representative Walters, yes, we do on both.
Go ahead.
So starting the healthcare financing unit on page 81, the first unit is 401, our administration unit. We do have 8 requests in this unit. And the first one starts on page 83.
Madam Chairman, members of the committee, settle in. It's healthcare financing division time. We have numerous requests. Most of what we talked about before with one-time funding issues in our introductory comments, a lot of those are in healthcare financing. So we'll have many exception requests in this division to work through. As Mr. McVicker mentioned, page 83 is our first exception request. And there's many of these in what we call our wings enterprise. Several of you were around years ago when we began replacing what we called the MMIS, Medicaid Management Information System. That was a a complete upgrade. It's a project that I'm very proud of. Jesse Springer behind me has really spearheaded that to modernize the Medicaid technology infrastructure. And we have several requests related to ongoing and some one-time expenses for enhancements and upgrades to that technology infrastructure. Across these technology requests in Medicaid, we generally receive a 90% federal reimbursement for system work, or for ongoing maintenance of those systems, a 75% match rate. So you'll see those corresponding match rates across many of these requests in Medicaid technology. The first one here is in our eligibility system, and there's various technical upgrades and enhancements, and also some mandated regulatory compliance we have from the feds. You'll see the cost on this enhancement is approximately $648,000 state general fund, with a corresponding $5.8 million in federal funds. So there's that 90% match that we mentioned.
Representative Larson.
Thank you, Madam Chairman. And Director Johansson, just for me, when we talk about this healthcare financing division, is that where most folks would consider Medicaid?
Madam Chairman, Representative Larson, yes, Medicaid and Kid Care Chip.
Thank you.
Madam Chairman.
Representative Walters.
Madam Chairman, this seems like a specific set of updates. Should this be one time or ongoing?
Eric?
Director Hibbard.
Mr. Chairman, I think we're just on the narrative of the budget, but if you're speaking to page 84, I don't know that you got there.
Madam Chairman, we were just about there. This request, there's only one out of the Wings Technology Enterprise that would be one time. Most of them are ongoing.
Is that it? Representative Larson.
In that, of the Wings request, priority 21 would be the one time.
Madam Chair and members of the committee, that's correct, number 21.
Moving on, Madam Chairman, page 84 is the second exception request, again, in this technology package that you'll see. This is operation and maintenance for the eligibility system. You'll see the general fund there is $250,000. The total request is $600,000. This would be ongoing for eligibility system in ongoing maintenance and operations. On the same, on page 85, priority 21, Representative Larson just mentioned, this would be one-time funding for integration costs to some of the modules that we have across the Wings Technology Enterprise. This is a $25,000 general fund cost with a corresponding $225,000 federal funding match.
Madam Chair,
Dr. Hibbard.
the table's correct on page 86. It should reflect one time.
Madam Chairman, moving to page 86. Also in the Wings Technology Enterprise, ongoing operations and maintenance. This is a $218,000 general fund request. The total request is a little bit over 1 million. Bit of a blended match rate here with 90% match and 75% match. So the average federal match on this request is 79% federal, 21% general fund. On the same page, page 87, priority number 23, also part of the technology enterprise we're discussing. This is our pharmacy benefit administration system. So handles claims and payments on the pharmacy side of Medicaid. This is a $500,000 general fund request with a corresponding 4.5 million, 90% federal match. On page 88, bottom of page 88 is our fraud, waste, and abuse replacement. I'll stop here and just mention that part of the beauty and the benefit of the technology replacement we've done across Medicaid is that it's instead of being one giant system as it was historically to maintain, that becomes very costly. It's been modularized. So we procured various components, which is why you see them broken out like this, to be able to essentially procure software as a service across these different functions. By nature of that, one of the downsides is that there's a lot of procurement work that goes on when the contracts or the systems, that contract expires, let's say after 5 years. And we've reached some of those periods since the wings replacement began, where we're re-procuring or replacing systems. This would be one of them in fraud, waste, and abuse. This is a system that helps us identify potential program integrity issues. And it is really what it sounds like. We look for fraud on the claims payment side. We look for abuse where folks are billing or providing inappropriate services, and this is the technical system that allows us to do that. You'll see on the top of page 89, this is a $150,000 general fund request with a 90% federal match of $1.3 million. Also on page 89, Madam Chairman, priority 25, again, still part of the Wings Technology Enterprise. This is in our data warehouse to be able to integrate this system with as many other Department of Health and Medicaid systems as possible. $50,000 general fund cost for this request, $450,000 in federal, again, a 90% federal match. On page 90, priority number 27, this is also related to our technology system, but overlaps with what we call our Medicaid call center or customer service center. We've seen extremely high volumes, historically speaking, largely due to the public health emergency, the pandemic, and especially over the past year, as you all know, because of federal policy changes, we have been going through what's referred to as the unwinding in Medicaid, where we are reassessing eligibility on every client in Medicaid because during the pandemic, federal policy in Medicaid disallowed all states from disenrolling Medicaid members. So many Medicaid members have been on the books in Medicaid for, in many cases, a number of years. That unwinding process started earlier this year, and we will complete that soon, where we've assessed eligibility on virtually the entire Medicaid program to see if those folks still meet qualifications, and if not, they are disenrolled. By nature of that, we have, and we expected this, we've seen more call volume and customer service demand because of that eligibility work that's going on. We anticipate for a period of time going forward that higher call volume and customer service need will continue. This is related to that so that we can keep our wait times in the call center and our customer service metrics as high performing as possible. This would be a $375,000 general fund cost with a 75% federal match of $1.1 million.
Representative Larson.
Thank you, Madam Chairman. Director Johansson, is the end of that pandemic or public health emergency took place, we read nationwide there was a lot of concern about the reevaluation and the disenrollment. Can you just share with us how you feel that's gone within this agency and any concerns that from the folks being evaluated?
Director.
Madam Chairman, Representative Larson, I'm happy to, and I will say I'm proud of Wyoming Medicaid and the staff that have worked hard over the past, really, we've been anticipating this for 3 years. The past calendar year has been incredibly burdensome in the level of work that it's required. I'll remind folks that Wyoming does this work with a handful of state staff, where many other states who operate their Medicaid program through contract or managed care have multiple companies to do this work. My staff has done an excellent job, not ashamed to say that, in working through this unwinding. We heard concerns early on about, from both perspectives of we need to go as fast as possible on the disenrollments, while also we need to make sure that we don't kick people off of coverage. We wanted to be in that right balance of ensuring that we're doing our fiduciary responsibility, making sure that folks who are eligible are receiving the services and the funding in Medicaid, and folks who are not are removed from Medicaid eligibility, while making sure that we had a stepwise process to ensure we didn't make clerical administrative errors and inadvertently disenroll people from Medicaid who would then qualify and have to go through the redetermination process. I think we've struck that balance, Representative Larson. It's not easy to notify folks that they're losing coverage in Wyoming Medicaid, but the team's done a good job making folks aware of other options, exchange marketplace plans, et cetera, other Department of Health programs, and I think we've struck that balance. I can have Mr. Grossman, if you need, provide an update on the numbers of what we've seen. Approximately, in very round numbers, around 10,000 individuals coming off of the rolls of Medicaid. But keep in mind, through this process and through the pandemic, our enrollment was artificially inflated. There were folks who were on the program, but we did not see using any services. Probably didn't know they were eligible or didn't need services. In terms of the unwinding in our disenrollments, what I would have been concerned about early on when we started, if we saw nursing home clients, developmental disability waiver clients, folks that we know based on their conditions, their categorical eligibility will continue to be on Medicaid. If I saw high percentages of disenrollments happening there, it would be very concerning, but we didn't. What we've really seen is folks who no longer, like in our children, whose family income has increased beyond the eligibility threshold. Our family care adults, for example, whose income has increased during this period of time beyond the eligibility threshold, that's where we've really seen the bulk of disenrollments. And I think that's appropriate, where Wyoming has its eligibility standards set, its income standards set for Medicaid, and we need to make sure going forward, post-pandemic, that the appropriate folks are on Medicaid. Representative Larson, long-winded answer to say I think it has gone very well, and I'm pleased with the work from the team.
Madam Chairman, members of the committee, moving on to page 95, the next unit. That's unit 420, and it's the Children's Health Insurance Program, also called CHIP. And we do have one exception request that starts on the top of page 96.
Madam Chairman, members of the committee, in our CHIP program, as I mentioned in my introductory comments, for several years, the federal government had an enhanced CHIP match rate. We knew, this committee knew over time that would be ratcheting down due to federal and congressional action. It is traditionally a 65% federal, 35% state split. For a number of years, it was an 88% federal match. And that has ratcheted down. That has been winding down. This exception request is a reduction of federal funds and an increase in general funds to reflect that new federal match rate. And I should mention, Madam Chairman, our CHIP program, it's a program specifically for children who are slightly above the eligibility threshold for traditional Medicaid children, which goes up to 138% of the poverty level. CHIP is a bit higher than that. I believe 200% of the federal poverty level. That is who CHIP provides coverage to, is a slightly higher income threshold for kids. And again, this is going back to the traditional match rate of 65% federal, which is the statutory floor in the federal world, and 35% state.
Part D clawback. And there is one exception request on the top of page 99.
Madam Chairman, top of page 99, we'll have two exception requests that are similar in the Medicare world. Just a brief 30 seconds on background. We do have individuals in Wyoming who qualify both for Medicaid and for Medicare. We typically call them duals or dual eligibles. By nature of that, we have a couple of programs where the federal government passes along costs to us because of what Medicare has in place as either policy or regulations. This is one of them where years and years ago, I believe during the Bush administration, the Part D prescription drug benefit in Medicare was passed and legislated at the federal level. Our dual members that are both eligible for Medicare and Medicaid, we essentially get a bill from the federal government of what the Part D costs are for the states that have dual members on Medicaid and Medicare. It's frustrating because there's not a lot of control we have over this. We see Part D costs at the federal level for general Medicare beneficiaries have increased over the years. And this is the case for the costs that they pass through to the states. Both with this exception request on Part D clawback, and a little bit later, we'll talk about a similar exception request for Medicare buy-in, where we pay that individual's premiums and cost sharing. There's a benefit to the state, as frustrating as it is to get a bill from the feds. If we don't pay this, then we basically, our Medicaid program will assume more of those costs, in this case on the pharmacy side. A little bit later, when we talk about Medicare buy-in, potentially fourfold on covering all of that individual's healthcare expenditures. So it's in the best interest of the state to cover these costs, as frustrating as they are to get passed through from the federal government, because Medicare does foot a significant portion of these members' healthcare costs, in this case pharmacy, where the state Medicaid program would be on the hook for those costs otherwise.
Representative Larson.
This might be a question to Erica. Historically, when we've had these types of required payments on the clawback and the dual enrollment thing, we paid that up front to make sure that there's no question that it'll get paid. So was it the governor's intention to use reversions, or was that budget department's idea to use reversions rather than making sure that it was in the budget to take care of it as we need to?
Mr. Chairman, Representative Larson, I will defer to Kevin on that one because we did have some discussions about how to handle that and then use those reversions on that.
Madam Chair. This will be a little bit of a preamble to other conversations later in the budget where you see this flexibility. But this is motivated because we're keeping the eye on the structural nature of the budget through time, not just now, but in January, the next biennium, we have to be thinking about the structural approval of the budget, because we may not enjoy the funding that we have in the future that we do today. You heard me speak of the fact that there's $305 million that we brought from the prior biennium because the Craig outperformed, and hopefully we continue to outperform. But that $305 million is not a structural dollar. A structural dollar would be the anticipated Craig amount on oil or gas, et cetera. So we're careful not to get ourselves positioned in the future, predicated on the Craig estimates, to get more standard general fund money in the budget than what we believe the profile can handle. And in fact, I think there are some comments later on about reviewing the profile, but that's the motivation behind this conversation, is to be clear and understand what the ongoing costs might be.
So does this go as you have it funded? Does that go into the standard budget, or because this is an ongoing cost that's going to be associated with the clawback, and so as we have it funded, are they going to have to come back and do the exception request in the next biennium, or what's your plan there?
Mr. Chairman, this would be a one-time allowance for the department to use anticipated reversions for this. And I believe this could be represented as an ongoing cost. But there is, and I'll allow Senator Johansson to comment on the backfill of this particular standard budget in other methodologies through Medicaid.
Representative.
I know you kind of got a plan. I just want to make sure, because it will be an ongoing note. The ongoing cost has been reviewed. So, as we have here, will it be in the next standard budget, or we can have to do another exception request to include this plus what we anticipate the increase will be in the next one?
Mr. Chairman, Madam Chairman, excuse me. Just want to point out that the Department of Health enjoys $188 million worth of expansion in their budget. $87 million worth of general funds, $101 million of approved governor's recommendations, $187 million. That's just a point that I want to draw in. I will allow Stefan, Director Johansson, talk about the backstop reality of this particular thing. If nothing changes, this would be, I would anticipate the department would ask for this request again. And at that point in time, we'd make a recommendation whether or not we do reversions or one time or ongoing in accordance to the structural nature of the profile.
Dr. Johansson?
Thank you, Madam Chairman, and Representative Larson. To add to what Director Hibbard mentioned, as you'll see in the narrative on page 99, the justification section, and again, it's an unfortunate reality of a cost that we're required to pay. So we discussed this with the governor and his staff on could the Department of Health cover this expense with reversions, as you see in the recommendation. The answer to that is yes, and that's why we brought up our reversion projections at the beginning to give you a sense of what we think those will be going into the next biennium. But Representative Larson, you're absolutely correct. Those costs have to be paid regardless, and you'll see in the narrative, if they're not, the federal government will just likely withhold payments in the rest of the Medicaid program until that's adjudicated as paid. So we can cover this cost if we have those reversions available one time. But to Director Hibbard's point, Part D clawback is one of those coverage areas where if there's an increase at the federal level, we will keep bringing that cost back to you. And so covering it one time, you'll either see it in the supplemental session or in the 27-28 biennium request as well.
Representative Larson?
And I'm just wanting to make sure that we've got the structure of this going forward accurately. So historically, we've put that in the standard budget because the number of enrollees continues to increase. And so we've not seen a decline in the Part D premiums. And so that's just continued on. And so as this is structured, I'm fine paying, I guess, with reversions, but I think it should, in my mind, I'm thinking it should be in the standard budget to be included. Or as I mentioned, it would appear to me that we would have to request this 9.3 million again in the next biennium, plus what increase that could be another 9.3 million. So you'd see an exception request if we do it this way is 18 million.
Madam Chairman.
Yes.
Representative Larson, you're right. I will say we should hold out hope for light at the end of the tunnel that isn't the train. And there is a remote chance that things like prescription drug costs through federal policy and negotiations, et cetera, go down. I think that's a big topic in Congress, but we anticipate based on recent history that these costs in Medicare will likely continue to increase. And it's really for two primary reasons. You mentioned one of them. Wyoming does have an aging population. So anything that relates to our long-term care programs in Medicaid, and in this case, folks who are eligible for Medicaid and Medicare, we see more enrollment in those programs. Secondarily, on the Medicare side, as some of you know, not trying to age anybody here, but Medicare premiums and cost sharing over the past 5 or 6 years have also gone up on a linear trend. So those costs with an aging population and increasing, federal policy as it relates to premiums and cost sharing results in these increasing costs. But I do think, at what point at the federal and state level, do you get frustrated enough with the linear increasing costs for things like prescription drugs and Medicare costs? I do think there's a chance policy in the coming years helps improve that at the federal level. But for now, this is what we see in the costs that are passed through.
Representative Stitt?
Madam Chairman, Director Johansson, you may have mentioned this already. I see that this line item is to be paid with reversions. In the past couple of years, the source of reversions, if I recall, was that the federal medical assistance percentage went up temporarily. But that's now over, basically. So what's the source of reversions now?
Madam Chairman, Representative Stitt, it's a really good question. And you're right. In the previous biennium and this one of the largest sources of our reversion potentials was the enhanced federal matches we had that helped reduce general fund burden. The biggest contributor to that was, unlike some other states during the pandemic, when states were prevented from disenrolling folks from Medicaid, certain states saw a lot of increased utilization and therefore increased costs. Wyoming didn't as much. And so we did see a general fund offset that led to our ability to have some of these savings. There's a few other areas across the board where we've come in under budget, and we're happy to prepare what those sources are. I don't have them all in front of me, but the largest one has been federal match and lower utilization in the folks that were enrolled in Medicaid. As you saw in our, I'll just mention again, on the one pager about our projected reversions, 21-22 to 23-24 biennium, you all legislated in the budget that we should carry forward $80 million. That was what, to fund some of those exception requests, as well as some general areas of the department, like our facilities, unanticipated Medicaid costs. We're not projected to be that high, but we still are comfortable that we'll see approximately 20 to 30 million in reversions on the general fund side from this biennium to the next, in addition to all of that.
Madam Chair.
Senator Anderson.
Madam Chairman, with your projections, this one item consumes almost half of your reversions?
Director.
Madam Chairman, Senator Anderson, yes, we don't have as big of a budget in reversions as we have in the past to fund some of these items. At $10 million in our 90% confidence interval here, that would be about half of what we think we would have available. But again, with 7 months left in the biennium, I think there's a range of uncertainty in our reversions. It could be much higher than that. Therefore, that percentage would be lower. But if we take a very conservative figure and say the Department of Health will have $20 million of general fund reversions, then yes, this request would eat up about half of that.
All right, further questions?
Madam Chairman, I believe the next.
Madam Chair and members of the committee, the next unit's on page 101. It's 432 dual eligible excluded drugs. There are no exception requests in that unit. Next unit is on page 104, unit 433, Medicare crossovers. There are no exception requests in that unit. On to page 107, unit 450, Medicare buy-in premiums. There is an exception request in this unit, begins on page 108.
Madam Chairman, members of the committee, what a beautiful segue from the discussion on the last one to this one. This is the same basic issue, but a different area of Medicare. In this program, as I mentioned, for our dual eligibles, Medicaid and Medicare members, we pay that individual's premiums and cost sharing to get onto Medicare, because it's in the state's interest for Medicare, which is 100% federal, to cover the bulk of their medical costs. This is once again an area where we get increasing costs from the federal government because Medicare premiums have increased and enrollment in this program has increased with our aging population. So you'll see a general fund ask here of approximately $9.6 million with a corresponding federal match. A lot of sticker shock there, but this would likely have, we've done some analysis. It's a little bit hard to put our finger exactly on the number if we didn't pay this. And essentially those folks didn't enroll in Medicare. Therefore, we would cover the vast majority of their costs. But we think it's safe to say that it would be 3 or 4 times this amount in covering all of their doctor's visits, hospital admissions, et cetera. It's in our interest as a state to have the feds pay that cost. With this unfortunate pass-through that we get from the federal government, I think it would be penny wise and pound foolish not to have these members on Medicare because Medicaid would shoulder the burden of their healthcare costs.
Co-Chairman Nicholas.
Thank you. So you're estimating roughly a $27 million savings in?
Say that again, Co-Chairman Nicholas. I am hearing comments from the public that they're having a hard time hearing us. So particularly us legislators. So be sure to get close to the mic if you could repeat that, Co-Chairman.
So you said 3 or 4 times. Is that times the 9 million number or what number?
Madam Chairman, Co-Chairman Nicholas, yes. So again, I want to be clear that we don't have a 100% accurate estimate because there's a lot of variables with who would enroll and who wouldn't. But we're relatively comfortable that that general fund ask would be 3 times, if not higher, 3 times as high if we covered the bulk of their healthcare costs.
Stefan, I'm curious, do you have a chart that you can provide to us that shows the increase in Medicare and Medicaid applicants over, like the last 10 years and what your projection is for the next 5 years, just based upon, our current population growths and just so we can do a little forecasting?
Is that online somewhere, Director Johansson?
Madam Chairman, Co-Chairman Nicholas, yes and yes and yes and no. We're happy to provide that. I think we've done a lot of work with the Labor Health Committee to show what's happening with the unwinding process and where we project the steady state to be across all of our enrollment groups, and we'll share that with the committee. So yes, the answer to the question is yes. It's online, but probably hard to find in the annals of LSO, Labor Health Committee, but we'll send that to the committee.
Wonderful, thank you. Okay, committee, it is 10:02. I promised you a break right now. We're going to take a 15-minute break. We will come back at 10:17. 10:17. All right, welcome back, committee members. We are back from our break. We're still with the Department of Health, whom we'll be with for the remainder of the morning. With a budget book larger than the governor's and the courts. Yeah, which we anticipated and certainly appreciate learning about this important department of our state. I believe that we left off on page 107, is that correct? And we,
Madam Chair, members of the committee, I think we're on page 111,
111,
unit 451, Wyoming health insurance premiums. There's no exception requests in that unit. Moving on to page 113, unit 460, adult services. There is one exception request in this unit and it begins on page 114.
Madam Chairman, members of the committee, on page 114, you'll see my priority number 1 exception request. This is related to a step 3 budget reduction proposal that we made, that the committee and the legislature ultimately directed the department not to implement, and restored that budget area with one-time funding. This was a use of reversions, I believe, to fulfill this step 3 reduction. This reduction proposal was a 2.5% rate cut to basically all Medicaid providers, with a few exceptions where we're disallowed from those rate cuts based on federal policy. So essentially, think of this as a 2.5% across the board rate reduction to hospitals, to nursing homes, to DD providers. It totals 2.5% rate reduction on a biennium basis is about $8.1 million of general fund, with a corresponding loss of 8.1 of federal funds. I'll remind the committee that in the step 2 reductions, we did implement a 2.5% rate reduction to all of these providers. And that has been implemented. That's on the books currently. What this was the step 3 reduction, which was an additional 2.5% rate cut that you all funded with one-time funding and directed us to bring this back. So again, the narrative is pretty clear on who it relates to, but it's essentially across the board 2.5% rate reduction. And again, about $8.1 million of state general funds.
Senator Anderson.
Madam Chairman, this is doctors and hospitals, right? This is all providers.
Madam Chairman, Senator Anderson, yes, there's a few exceptions like federally qualified health centers where we don't reduce that reimbursement. It's mostly federal funds. The Life Resource Center in Lander is another example where if we cut their Medicaid rates, we would essentially just backfill it anyways with general fund. So it doesn't make sense to cut that there. There's a very few amount of providers that it wouldn't apply to, but by and large, it's across the board, as you mentioned.
Director, is there a place online or can you provide us with a list of these providers in each county so legislators can see how many providers within their districts would be affected or are affected by these reimbursements? And so, I mean, I think that's a much more practical reality for legislators when determining these big budget requests, is understanding these real impacts on the ground in their communities from medical providers themselves and the patients that they serve.
Madam Chairman, we will provide the committee the best information we have. I'll just, a forewarning, I believe we have over 14,000 enrolled Medicaid providers, so the list can get a little bit long. We'll look at what we have by county. Some of that is in our annual report, maybe not by specific providers, but by the provider type. We'll get that as soon as we can to the committee.
Thank you. Representative Larson.
So I guess when you say 14,000, because not only is this doctors and hospitals and dentists, but it would be your DD providers, not only in those large settings, but the small independent providers that are providing for somebody within their own. I mean, that Medicaid reimbursement, those Medicaid providers are across the state and impacts all of them. So I think, Madam Chairman, your point is really good, and I think the best we can would be very beneficial.
Madam Chairman, happy to.
Thank you.
Madam Chairman, members of the committee, we're now on page 117, unit 461, children's services. There are no exception requests in that unit. Page 120, Unit 462, out-of-home placements, children. There is one exception request in this unit that begins on the top of page 121.
Madam Chairman, members of the committee, on page 121, you'll see priority number 12. This is a step 3 reduction once again, where the department being directed to prepare those step 3 reductions, proposed a full-scale elimination of the Children's Mental Health Waiver Program. It's approximately a $5.9 million biennial program, 2.9 million of which is state general fund. Again, this was a tough discussion to have with the committee a couple of years ago in our step 3 budget reductions, where we did have to propose some full eliminations of services and programs. This was one of them. The committee and the legislature ultimately, just like our previous exception request, directed the department not to implement this cut and restored the program with one-time funding. The Children's Mental Health Waiver operates as basically a managed care program to provide wraparound services for high-needs children with behavioral health issues. The way it works is, as I mentioned, kind of a managed care type concept where who we contract with here develops a network of enrolled providers to be able to provide those wraparound services to kids. This is something that began years ago, really as an intent to reduce the number of placements we see in what we call PRTFs, or psychiatric residential treatment facilities for youth, to instead provide community wraparound services to reduce reliance on those higher levels of care. I'll be blunt with the committee that the intent for this program was to have it operating, fully statewide, but managed care and network development in Wyoming is tough. So we do see counties, we do see areas where there's just not a lot of providers in this program. And that's both, as I mentioned, a result of, again, it's difficult to develop networks, to have sufficient providers in all communities or all regions, but also something that we continue to try to improve on the contract management side with our vendor to improve those service provision rates and provider enrollment rates in those communities. With this program, we are not where we need to be in that performance. I think there's a big opportunity with the amount of high needs behavioral health children that we see in the Department of Health, the Department of Family Services, and the Department of Education to use this program and this waiver to a fuller benefit. And we have some work to do to get there. However, without a reasonable alternative ready to go and in place for this program, I do not believe it's the right time to do a full-scale elimination through a budget cut of the Children's Mental Health Waiver. The reason for that is we have seen a lot of interagency collaboration over the last 2 years on this critical problem of our high needs youth in behavioral health. Several of you served on a task force this year that really looked at that issue in a granular fashion, both in terms of what the state's role is in facility-based care, but what options we have for community service provision for these children that are in need and often being served in emergency rooms or even jails. So while there's an absolute performance improvement that needs to happen in this program, I've seen successes with our care management entity that's the provider or the contractor for this program, where we have been able to refer youth that are in the Department of Health or DFS systems that do not require PRTF admission and can be served adequately in their community through these wraparound services. So again, I don't think the performance of this program is absolutely where it needs to be, which is the case in a lot of Department of Health programs. I'll be honest about that. We have room to grow. But in my view, now is not the right time to eliminate this program, given the problem we have with our high needs kids. And the governor and I had a lengthy discussion about this, and you'll see his recommendation on this program as well. With that, Madam Chairman, happy to stand for any questions.
Senator Salazar.
Thank you, Madam Chair. So Director, let me just get this straight. Without this funding, the reductions will begin in July of next year?
Madam Chairman, Senator Salazar, that's correct. The program would be eliminated by July 1st.
Would be eliminated?
Yes, sir.
Representative Larson.
Director, as you and I have had this conversation, you could probably give my speech for me. The concern that we've had is we've entered in contract with the provider, with the case management entity, with the expectation it would be developed statewide. And this was done a number of years ago, back when I was on Labor and Health Committee. It hasn't been, but we continue to fund it as though it was. So when you came back in the step 2 and step 3 reductions, this was one of those we says maybe we could eliminate. We heard loud and clear from the communities and from the agencies where this is provided on the success of what they provide, but it's just somewhat isolated. And so what I'd be interested in is of the contract based on what portion of the state it is functioning as, what percent is that contract does it represent? And maybe we adjust that and allow you the ability to look in the underserved areas for another management entity to try and get up. I'm just looking for ideas on that.
Madam Chairman, if I may, Representative Larson, your point's well taken. A couple of responses that come to mind. This, as I mentioned, this is a managed care framework. So you're right. I think the anticipation years ago from the state and from the legislature was to scale this program statewide. That has been disparate depending on the region of the county that you're looking at, where we see high performing counties and we see lower performing counties. And when I say that, to be clear, the county itself is not low performing. The program is, in terms of its ability to contract with providers and provide that service. Unfortunately, this is in a managed care framework, we pay on a per head basis. So the costs are, while we might be underserving certain areas, and frankly, Fremont County is one of them, we pay on a per member basis in the program. That's where the costs result from. But I don't disagree with you at all. Looking at the performance of the program, we're happy to provide that to the committee where we see the potential for improvement or growth is crucial. We can RFP. I think there's a few entities that can provide this type of model and this type of service. I do think we have a provider and a contractor that developed this model and has seen success, as you mentioned, in some of those areas where it really has been used and been more effective. But we're happy to follow up with the committee on some per county or per region data that I do find interesting, where we really look at the percentage of psychiatric residential treatment facility placements in that county. Let's say it's a certain amount, and the percentage of children's mental health waiver enrollment in that county. And there's some vast differences that we need to close the gap on.
Oh,
And I guess a little bit of the concern that I have too is when we looked at it in the step 2 and step 3 cuts, that entity came out and was very provided a lot of information and suggested how critical the work done, and assured us, I should say, assured us that they would move forward in getting that stuff. But I've not seen anything. They've been crickets, haven't heard anything from them and saying what they're trying to do. And if they're trying and their failures are justified, okay. But they don't return and report, and that's a little bit problematic for me too. So I'm just looking for answers because those services really are warranted and needed.
Madam Chairman, Representative Larson, point well taken. We do have information we can share with the committee on improvements that we have put into the contract that will take place in 2024. For example, in your neck of the woods, we have even recently, and this was information I received yesterday, had a provider contracted on the Wind River Indian Reservation, for example, that I think we can see improvements. But again, your point's well taken. There's gaps we need to close here with this program.
Senator Salazar?
So the county that we're talking about, is that because there aren't enough providers in that area that we're underperforming in that region?
Madam Chairman, Senator Salazar, it's a good question. And the simple answer is yes, and I think some of that is the lack of providers that are there, but also, you know, being part of a waiver program that has strict federal regulations, there's a lot of administrative standards that have to be met. So some of that it can also be unwillingness of providers to participate. It's not worth it because of that regulatory burden, et cetera. That's a lot of the problem we see with network development, especially in managed care frameworks. So I think both sides of that coin contribute to that. But again, I want to be clear that I think there's improvements we can make in the current structure to leverage and secure additional providers, even in areas with such a large geography like Fremont.
Continue, please.
Madam Chairman, members of the committee, we're on the page 124, Unit 463, Nursing Facility Services. There is one exception request in this unit, and that is on page 125.
Madam Chairman and members of the committee, page 125, the bottom of that page, you'll see priority number 10, to maintain nursing home rates at their current levels. Wyoming Medicaid Department of Health is the largest payer of long-term care and nursing home services in the state. We pay for approximately 65 to 70% of all nursing home bed days in the state of Wyoming. So we're a big part of this system. Last session, you all reviewed and approved a significant rate increase for nursing facilities. The intent of that, our budget request and the action you ultimately took, was to bring nursing home facilities as close as possible to what we call 100% cost coverage. Based on the cost reports that those facilities submit to CMS, we can discern what their allowable costs are in providing that service. And before last session, when you all took action on these rates, on average, Wyoming Medicaid was paying approximately 83% of the nursing facility costs. So the first conclusion there is, you know, we were dramatically below cost coverage in those rates. There's a little more nuance because the business model of a nursing home really drives what cost coverage looks like. Some nursing homes leverage a lot of private pay, which results in higher reimbursement from their private clients. Many nursing homes design their service and business model around Medicare rehabilitation, which has a higher cost plus reimbursement rate. And some design their business models around more custodial care, which is in a lot of Medicaid clients are more long-term clients, not rehab, but more custodial in their nature. So there really is nuance in how a nursing home's business model accounts for their cost coverage. But having said that, we brought that issue to this committee and to the legislature and to the Labor Health Committee in 2022. And long-term care facilities had not been rebased, had their rates rebased in a number of years. Long story short, you all took action to increase nursing home rates based on our proposal, our budget request last session. But half of that general fund cost that was in there was funded through Department of Health reversions, one-time funding, with the direction to come back and bring that in our 25-26 budget. That's essentially in a nutshell what this request is. You will see on page 126, it's approximately 16,500 or exactly 16,500,000 in general funds with a corresponding 16,500,000 in federal funds. As a concluding remark here, when the budget bill passed last year, and we knew we had that one-time element within the nursing home rates, I spoke with the facilities and their associations and mentioned we can, on July 1st of this year, so last summer, we can implement the full rate increase. But I want to be clear, and I wanted to be clear with them that there was an unknown of whether that would continue full into the next biennium or have to be slightly scaled back based on the will of this committee and the legislature. You won't be surprised, it was universally recommended to implement the full rate increase with the money we had, even though some of it was one time, knowing that that might be reduced in the future. However, with Wyoming's aging population, I do think it's prudent for the state to continue to invest in these nursing home rates to keep our long-term care market shored up and pay as close to cost coverage as we can. That seems fair, and that seems reasonable to me based on the clientele that they have. On the other side of the coin, you all have been very helpful in the legislature partnering with us over the years to make sure that our long-term care strategy with our aging population is not simply related to institutional or facility-based cost. We have a very robust community choices waiver, what we used to call our long-term care waiver, which provides home and community-based support for folks who qualify for nursing home stays but can be served in their home instead. That program continues. We've had good participation and a quite large increase in the percentage of our long-term care members in Medicaid that are served in their homes, which most people prefer and is cost-effective for the state. However, our nursing home industry in Wyoming and our nursing home partners in our communities absolutely need to be there and need to be healthy because that care is needed. And so I would absolutely support this request, and you'll see after our discussions with the governor, there's a favorable recommendation on this as well.
Madam Chairman.
Representative Stitt.
Madam Chairman, Director Johansson, what's the expected number of people who will be using nursing homes in the next biennium? I know you had an estimate, but I wanted to find out what your best guess on that is.
Madam Chairman, Representative Stiff, I don't have the numbers off the top of my head. I'm not sure if Mr. Grossman or Mr. Springer have that. If not, we can provide that post haste. The total enrollment. Representative Stiff, Madam Chairman, if I may, getting whispering in my ears, approximately 1,200 clients per month. So a steady state of around 1,200 enrolled in nursing facility coverage.
Madam Chairman, follow up?
Yes.
So just for clarification, so the narrative talks about over some number over 2,000, but I take it that's the number of unique individuals, but it's 1,200 per month of, if you considered it as a series of hotels, that's the occupancy. Is that the idea?
Madam Chairman, Representative Stiff, that's a great metaphor. Yes, you're correct.
Madam Chairman, members of the committee, we're on page 128, Unit 464, hospice. There are no exception requests in that unit. On to page 131, Unit 470, optional services adult. There are 2 exception requests in this unit. They are both located on page 132.
Madam Chairman, members of the committee, priorities number 6 and 7 on the bottom of page 132. This was a step 3 budget reduction proposal we made that we were directed not to implement. The funding was restored on a one-time basis. This was reductions to our adult dental and vision services in Medicaid. The majority of that is on the dental side, with I believe $100,000 of this request on the adult vision side. You all made the decision, again, with one-time funding, that maintaining our adult dental and vision coverage was important. While it's a small expenditure item, relatively speaking, in Medicaid, dental services we can see lead to worsening and more expensive conditions, emergency room visits, et cetera. And so we've brought this back for your consideration. You'll see in the bottom of page 132, the dental coverage for Medicaid adults is approximately $1.3 million of this request, and the vision coverage for those adults approximately $200,000 of this request.
Madam Chairman.
Representative Walters.
Thank you, Madam Chairman. Question for Kevin here, as the governor's recommendation says he recommends approval of the ongoing exception request contingent upon the final fiscal profile. So the final governor's fiscal profile showed about 50 million available, if I remember correctly. So does that mean he approves this or not?
Madam Chairman,
Director Hibbard.
you're correct. $50 million is left on the table. It's an approval.
Madam Chairman, we are on page 130, sorry, it's my place here. 135, Unit 471, Indian Health Services. There is no exception request in that unit. Page 138, Unit 472, Wyoming Life Resource Center. There are no exception requests in that unit. Page 141, Unit 483, Community Choices Waiver. There is no exception request in that unit. On to page 145, Unit 485. There are 2 exception requests, and the first one is on page 146.
Madam Chairman, this is in our developmental disability waiver program. As Eric mentioned, the first exception request is on page 146. This is a restoration of a step 3 cut that was proposed. The legislature directed us not to make these cuts and restored the funding on a one-time basis with direction to come back in this budget to ask for it again. This is relatively large. You'll see $10.2 million general fund with a corresponding $10.2 million in federal funds. On the bottom of page 146 and going into page 147, you'll see 4 items or bullet points there that talk about what this budget cut would entail. This would essentially change policy on what we call our Extraordinary Care Committee. It would be severely restricted. That committee essentially considers emergency requests from waiver participants to see if a budget should be increased because of a crisis situation or some other event that's taken place. We refer to it as the ECC. Happy to get into the details of how that works. The second would be a 2.5% reduction in the reimbursement rates specifically for the comprehensive and supports waiver. So similar to what we discussed before on a straight rate reduction, this would be part of this package, but would be specific to the waiver providers. We would also essentially level set the methodology for the current DD waiver and acquired brain injury waiver participants, which would result in budget reductions for some that have had historically high budgets. That's a policy we've discussed with you all numerous times. When you did the DD waiver redesign about 7 years ago, participants were grandfathered into the previous budget methodology. This would essentially change that and level set everybody to be equal. Whereas right now, for the past several years, that's happened through attrition, where new members that come on the waiver do have that leveling or that equalized budget methodology. This would preempt that and implement it quicker. And then finally, there would be a severe freezing of the wait list. I want to spend just a moment on that because as you all will remember, the past 2 sessions, you all have invested in the developmental disability providers, both in terms of rebasing rates, reimbursement rates for both larger providers and for small independent providers, but also providing funding last session to fund people off of the wait list. We had gotten to a point where families were waiting 2, 3, 4, sometimes 5 years to have a slot open up on the waiver to be off of the wait list. Through the appropriation you guys authorized recently, we've been able to fund and are continuing to fund people off the wait list, where our goal is not to have folks waiting longer than 18 months on the wait list. So again, this budget cut that would take effect in July of next year would include a pretty significant freezing of that wait list in order to conserve those state general funds. So again, not to be alarmist, but this was a significant, step 3 reduction that would pretty dramatically impact our waiver service provision for folks with developmental disabilities. With that, Madam Chairman, happy to answer any questions you have.
Senator Salazar.
Thank you. So, Director, let me ask you a question about the independent providers, because I am hearing from them in my district. A lot of them, incredible work they do. And I'm being told that, if it weren't for them, there wouldn't be anyone taking care of these folks. But their reimbursement, the salary that they do receive is barely adequate. So you're telling me that if this is not fully funded, they would be even hurt further next year. Is that correct?
Madam Chairman, Senator Salazar, that's correct. And your point's well taken. Wyoming's done a good job, I think, in our DD waiver system, supporting both larger, what we call agency providers, as well as small independent providers, which actually represent the lion's share of the number of DD providers we have. So I couldn't agree more with the point you made. Yes, the unfortunate reality of this budget reduction, should it take effect, is that it would hit both those larger providers and your smaller independent providers
Madam
pretty
Chair,
hard.
So assuming this is then fully funded, that this request is granted, tell me what the scenario is in that instance for these independent providers.
Madam Chairman, Senator Salazar, essentially what this request would do is keep us where we are today in terms of the funding in the system, as opposed to reducing it on July 1st. But it works in concert with the legislative action that was taken in the previous session this year, where rates for both agency and independent providers were increased, were rebased. That has been implemented. So right now, this funding is currently in the budget on a one-time basis, and your previous legislative action to increase rates, which I believe were implemented this fall, October 1st, just a couple of months ago, are both in play right now. This would result in a reduction if it's not funded.
Last question, Madam Chair. So was there a point in time where these, there was greater support than has been? I mean, is this sustaining a cut that already occurred perhaps pre-COVID? I mean, have these independent providers seen better support than as currently given right now?
Madam Chairman, Senator Salazar, a couple of responses there. So back in 2017, before the step 2 and step 3 reductions in more recent memory, the Department of Health was directed to make significant reductions back in that time period. That was also north of, I believe, $100 million. And the DD waiver system did take cuts then. Over the past couple of sessions, the legislature has more so protected the DD system, which we also did in our step 2 proposals, where we minimized the cuts to those providers. Then unfortunately in step 3 had to propose, this is a big line item for the department, had to propose additional cuts there, which again, have not been made. So a nuanced answer, I apologize, might not be making sense, but cuts were made back in 2017. Then in recent years, rate rebasings and additional funding for the DD system has been put into place, even as recently as last year. This funding, which would have been cut in step 3, was restored on a one-time basis. That's the nature of this request, to prevent an additional budget reduction taking effect in July 1st of next year.
Representative Larson.
Thank you, Madam Chairman. So Director Johansson, would it be fair to say that with a baseline of funding that existed at the point 2017, then again, when we made the step 2 and step 3 reductions, with nothing else changing in there, we had said that cut in the step 2, step 3 are too significant. We funded them one time. We're trying to insert that back in the standard budget. However, at the same time we're doing that, there's a change. We do an additional rebasing. We look at the wait list on people waiting to come on to support waivers. And last year, we implemented a rate adjustment and reduced the wait list that is separate from this conversation. And so that went into play. But as nice as that is for the providers, if we don't reinstate this component in, it would result in those reductions being made permanent, and it'd be a hit of about $10 million.
Madam Chairman, Representative Larson, that's correct. The way I frame this is, over the past 2 legislative sessions, investments, as you mentioned, have been made in rates for DD waiver providers, as well as funding individuals off of the wait list. So budgets for individuals to seek services from providers, both have been increased. Again, I worry about being alarmist here, but not funding this exception request, in my judgment, would be kind of counterintuitive to the action that the legislature has taken over the past 2 years, essentially one step forward in shoring up some of those rates and family budgets on the wait list, and 2 steps back with the budget reduction that would take effect here.
Representative Henderson.
Thank you, Madam Chairman. I want to be an alarmist. Looking at the next 2 years with the expectation that, you know, the demographics and all things considered, would you, Director, feel that we might want to make sure this happens rather than have it iffy?
Madam Chairman, Representative Henderson, it's in my budget request so that we can get off of the iffy train and put this back into standard budget.
Is that 50 or Jiffy?
Madam Chairman,
Representative Stitt.
Director Johansson, I see the method here of restoring or making sure that we don't have these step 3, 2.5% cuts to providers. Kind of get the methodology here. And it just turns out that once you add up all the numbers, it's really expensive, right? So use an example that I feel like I have a better understanding of the service being provided back to nursing homes just for a moment. It looks like if there are 1,200 occupied beds on average in a given day across the state for nursing homes, and if the pass-through cost is $306 million, and it's expensive, right? It comes out to about $350 per night per person. And so my question is, if instead of, and if we don't do the 2.5%, instead of it being $350 a night, it would be like $317 or something, or 23, say, a night. What are the economics of this? If instead of funding the whole $33 million as requested, what if we said, hey, we'll meet you halfway, resulting in a 1.25% reduction? How much is that going to, hurt the providers? I mean, we don't want nursing homes to shut down. We don't want disaster. But what's your sense for the economics of what it takes to make a nursing home work, if you know?
Madam Chairman, Representative Stith, it's a really good question. And let me react in a few ways. As I discussed with the long-term care associations, I think there was a welcome spirit for any increase in those rates that the legislature would invest in. My proposal was to get us as close to 100% cost coverage as possible to make the economics work in those facilities. A lot of nuances I mentioned on how a nursing home develops its business model and what pay sources they rely on. For example, if you are heavily staffed and structured to do a lot of intensive rehab, which requires a different type of staffing level, and then you admit too many Medicaid patients, which pays at a lower rate, and your staffing structure is really geared towards Medicare rehab or even private pay, that cost coverage gap grows exponentially. Whereas if you have a facility, a nursing home that has staffed its facility similar to how we do in Basin at the state's nursing home, custodial care on Medicaid rates can be much more sustainable. Maybe not perfect, but more sustainable in the long run. I don't know, I can't answer you specifically on what certain cut points are in those budget reductions for nursing homes and what it will result in terms of enrollment or even closures. But I can say that we did, just in the last year and a half, we did see a nursing home closure in Bighorn Basin with Bonnie Blue Jackets no longer providing service. The retirement center, our state facility that we operate, absorbed a lot of those patients, which was a nice thing to have for the community. Not across the board, but a lot of family members didn't have to look in Casper or even out of state because of that closure. Was that closure directly related to low reimbursement rates from Medicaid? The answer to that is no, but it's part of that equation. And I do think that what we've seen in other states in the long-term care market does support the conclusion, and from my perspective, of the closer that we can pay in long-term care to cost coverage, the more sustainable our rural and frontier nursing facilities will be. I wish I had a number for you to say the system can absorb, a 1.5% or a 2% cut. I think in many cases it could, to be quite honest, but we just don't know what those cut points would be. And I think it's worth the investment here and in our, as we've done over the years, in our community-based programs for long-term care. Given how rapidly Wyoming is aging, this demand is only going to grow. And I think supporting the industries that serve those folks, both in facilities and in community-based programs, is important.
Representative Larson?
Thank you. So Director Johansson, last year, when you considered bringing the nursing home costs up to theoretically 100% of costs, you base that on the fact that we had that 2.5% step 3 reduction restored, even though it was one-time funds, so it was already based as though that was in there to get to this conclusion. Is it fair do I understand it correctly when we say 100% of costs, that there is methodology that says these are allowable costs, not everything you want to bill back? So like if a professional say as an attorney that I trying to determine what I'm going to bill to my client, what will they allow me to bill and what will they not allow me to bill? And I want to bill all that I can. But the guidelines there is and we were at about 83% of allowable costs. So all of the costs, we says, you can charge for those, but we're only reimbursing at 83% of them. And you tried to bring that up because anybody that's trying to run and can only bill at 83% of what's allowed causes problems.
Madam Chairman, Representative Larson, very briefly, you're right. And essentially, that forces a certain amount of cost shifting onto private pay or, as I mentioned, Medicare stays that are more rehab focused than custodial. So you're right. I will also mention that the cost data that we have come from and are calculated based on what we call CMS cost reports. Hospitals and nursing homes have to file those with the federal government. And you're absolutely right. There's a certain range of allowable costs that Medicare calculates, and that's what we base this off of. Secondly, it's worth mentioning cost reports, there's a lag. So the cost reports that these data were based on are now 2 years old. So we can't fully account for the impacts of additional inflation that occurred, additional healthcare cost inflation that occurred during that time period. So when we say close to 100% cost coverage, it's important to remember that is a bit of a lag in terms of the time that we receive that data and analyze it.
Follow.
So Director, if you go to that chart at the end of Unit 463 and you look at that total budget request of total funding of $306,771,000, can you help us understand that for simple math, is that a reasonable cost per patient per day? You look at that and it could be as high as $125,000 a year per person. Is that what we're seeing?
Madam Chairman and Representative Larson, yes. So you see a wide range of per day costs depending on the payer. What we know is private pay rates for nursing homes are easily in excess of $700 a day, which when folks need to receive nursing home stays can very quickly drain their assets, which then essentially get people onto the Medicaid program because we begin taking over as a payer for long-term care in those facilities. The rates that you see that we pay, again, historically, before the action you all took this past year, were approximately at 83% of cost coverage. With the upper payment limit supplemental programs we have, we were around, I believe, just south of $300 a day, in the 270s, 280s. The rate that would be as close to recent 100% cost coverage, again, with that data lag we have, is north of $300 a day. And I think based on a multi-payer mix that a facility has with private pay and Medicare, again, sustainable rates in Medicaid closer to that 100% cost coverage can make the business model work, even with a more intensive staffing structure that provides rehabilitative services and higher levels of nursing, PT, OT, et cetera.
And so, Mr. Vice Chair, when I run the numbers, what that boils down to is of that $300, the state is paying roughly $100 out of the 300. Is that fair? I
Mr.
take the 125 and I take the total numbers, your 306, and I just run the numbers out. But that's about what it comes to.
Mr. Chairman, I don't do well with math in my head, but on those rates, there's basically three different pay sources on the Medicaid side. One is the state general fund and a 50% federal match on top of that. In addition, we have our, what we call UPL or upper payment limit programs for long-term care, where essentially we assess a fee on all of the participating providers. We then match that with federal funds and redistribute that as a supplement to the rate. So the math is a little bit different because there's kind of three parties involved, but yes, I think generally you're accurate.
Mr. Chairman. Mr. Chairman, you know, all this, we're striving to just meet their cost. It troubles me that we're relying on the private pay and the insurance pay to keep the institutions afloat, but we're only going to pay their cost. Is there any change, do you think, to that? Will we ever pay more than just the cost for these institutions?
Mr. Chairman, Senator Anderson, I'm glad you raised that question. It's a tough answer, but we are generally prohibited in Medicaid from paying above what Medicare would reimburse. That's what's known as the upper payment limit. So those supplemental payment programs we have, UPL as we call them, they close the gap between that allowable Medicare cost and what Medicaid is paying. But generally speaking, there's a few exceptions to this across the Medicaid enterprise. We are prohibited, Medicaid programs are prohibited from paying above what Medicare would pay. So it really, generally speaking, it's a cost-based rate. In some cases, cost plus certain percentage. So simple answer to your question is no, we typically will not go above that and cannot go above that threshold. But again, I would just stress that there's nuance to how the economics can work in long-term care, where if you have payers that pay your cost or pay even cost plus, and sometimes you have payers that pay below your cost, but it still works to the facility's advantage to serve that resident because in that multi-payer system, you can make it work. And there's economies of scale with admin and overhead that, again, a custodial Medicaid patient can be part of that, overall payer mix, even though it's reflected on the balance sheet as below the average cost of the facility, if that makes sense. So too nuanced of an answer, I apologize, but I agree with the sentiment that you articulated that, yes, in many of the things we've brought this committee and the legislature on the Medicaid side, we are looking in many cases to rebase rates, that haven't been looked at in years or sometimes even decades to get as close to cost coverage as possible, which for a safety net program, I think can make sense. We want to pay the provider their cost, not profit margin or overhead or et cetera, but pay their costs and ensure that access. But it's a real delicate balance when, we're not the only game in town.
Okay, Eric, fire away. We can start running through some of these pretty quickly.
Yep. Mr. Chairman, we're on page 150, unit 486, supportive services waiver. There's no exception request in that unit.
Okay,
And we
good.
complete HCF. At that point, you're in public health.
One second. Senator Larson.
Can we go back to 140 to 485, the justification? Did we talk about the one the governor denied? The priority 11 step 2 on the comprehensive.
Mr. Chairman, I apologize. We inadvertently skipped over that. The bottom of page 147, moving into the top of page 148, there is an exception request, priority number 11. This is the only step 2 reduction that the legislature restored, but restored with one-time funding. This was a smaller reduction to the developmental disability waiver, essentially removing certain services from the waiver that are available through the Medicaid state plan, things like physical therapy, occupational therapy. On the waiver service, it can be provided as what we call a habilitative service, meaning ongoing. In Medicaid state plan, that's generally rehabilitative, which means a condition needs to be present that you're rehabilitating. This step 2 reduction would have eliminated some of these services as a waiver service and relied solely on the Medicaid state plan, to provide those. It's about $967,000 of general fund, $967,000 of federal funds. You'll note the governor's denial here. Again, lengthy discussions about all of our exception requests in the endeavor to try to balance the budget and balance the general fund. I don't think this is an indication that there's not support for our DD clients and providers, but a difficult decision in light of the step two cuts that were mostly taken. This one was not per legislative direction, and thus that's the discussion we'll have with you on this exception request. Mr. Chairman, sorry for skipping over that one.
Madam Chairman. So example wise, currently, if you've got an individual who is acutely developmentally disabled, maybe muscular challenges, they receive habilitative services through the waiver that allows them to maintain mobility, speech therapy, so they can maintain a swallowing reflex. If you do away with this, the only time they could get services, for example, is if they can't swallow anymore. So then they would get rehabilitative services through Medicaid until that swallowing reflex is once again established, and then it would stop again. And so there's this up and down of maintaining the type of mobility, if you will, even as limited as it is for some of those who are acutely disabled. But it's a swing back and forth. And so that was the conversation we had, I believe, for the step two, and warranted and felt it was in the best interest of those to be able to keep as much mobility as they possibly could on a habilitative level. And I think that was kind of why we moved in funding that and making that recommendation. Am I getting that accurate?
Madam Chairman, or Mr. Chairman, Representative Larson, yes, that's accurate.
Thank you.
Madam Chairman.
Madam Chairman. So, Stefan, do we have any idea how many folks would fit into that category of where they regularly require rehabilitative care versus?
Madam Chairman, Mr. Co-Chair, approximately 80 at any given time. 80.
Madam Chairman, members of the committee, we've completed healthcare finance and are moving into the public health division. Page 155, Unit 501, Public Health Administration. There is one exception request that begins on the top of page 156.
Madam Chairman, members of the committee, our first public health division exception request on page 156. This is no general funds. Essentially, we get gaming commission basically tips revenue into the Department of Health to address problem gambling and prevention. This is essentially allowing us to have this funding that comes from the Gaming Commission into our standard budget.
Madam Chairman, members of the committee, on page 159, Unit 502, Public Health Preparedness. There's one exception request that begins on page 160.
Madam Chairman and members of the committee, page 160, this is essentially a migration of a position from the Public Health Division to the Behavioral Health Division, which has occurred. This is related to our 988 Suicide Lifeline. That work used to live in our Public Health Division. We migrated that in order to be closer and more closely managed to our treatment providers when we stood up the 24/7 Lifeline to have that position in behavioral health. We'll talk about that exception request for that position when we get to the Behavioral Health Division. But as you see here, this is a reduction from the Public Health Division because of that position move.
Madam Chairman, members of the committee, on page 164, Unit 503, Emergency Medical Services and Hospital Preparedness. There is no exception request in that unit. Moving on to page 169, Unit 510, Rural and Frontier Health. There is no exception request in that unit. On to page 174, Unit 522, Immunization. There is no exception request in that unit. On to page 178, Unit 523, Maternal and Child Services. There is no exception request in that unit. On page 183, Unit 524, nurse home visitation, there is no exception request in that unit. On to page 186, Unit 525, Women, Infants, and Children, or the WIC program. There are no exception requests in that unit. Then on page 190, Unit 526, Public Health Nursing, there is one exception request in that unit, and that begins at the top of page 192.
Madam Chairman, members of the committee, the Public Health Division, Stephanie Pyle and her team were very kind to you all and us this year. A lot of these exception requests are reductions. This one in Teton County Public Health Nursing recently, I believe as recent as September, they elected to become an independent public health nursing model. As you might recall, in the public health nursing statutes, counties can elect basically three different models: a state-based model, a shared partnership, or a completely independent county-based model. Teton has elected to move to an independent model. So what that requires us to do is in all public health nursing, the split is 65% state funded, 35% county funded. So when a county goes independent, we transition the state employee 100 series salaries to 600 series and provide that to the county that's now independent, of which there are now 5. Natrona County, Laramie County, Sweetwater County, Teton County, and Campbell County. So that is what you see reflected here. The 600 series has been provided per contract, through contract to Teton County. The delta is what would be, and the positions, you'll see 4 positions here, is what would be reduced out of the budget. Happy to stand for any questions.
Madam Chairman.
Representative Walters.
Thank you, Madam Chairman. Your narrative and the governor's rec on page 192 shows an elimination or a reduction, 3 FTE and 1 part-time. The table on page 194 shows a reduction of 4 FTE. So just trying to make sure I understand if it should be the narrative or the table.
Madam Chairman, Representative Walters, 3 full-time and 1 part-time is the accurate figure.
Thank you.
Madam Chairman, members of the committee, we're on page 196, Unit 531, Cancer Screening. There is no exception request in that unit. Page 201, Unit 532, Public Health Laboratory. There is one exception request in this unit. It begins at the top of page 203.
Madam Chairman, members of the committee, on page 203, you'll see a lengthy exception request for our Wyoming Public Health Lab. I have to put a plug in for our public health lab. It's our state's only public health laboratory. And quite frankly, I think it's an envy of our region and potentially the nation. These folks do great work. We have some very, very advanced staff and employees that do some incredible things at the lab, not just for things that you would think are typical of public health, disease surveillance, all of the work that happened during the COVID pandemic, et cetera. But also law enforcement is a huge client for us when we do chemical testing, urinalysis, et cetera, testing white powder incidents that come to us from a variety of places in the state. And our director there, Dr. Joseph Reed, who is here with us today, he reports up to Dr. Harris, who's also with us today and can answer questions should you have them. They just do fantastic work at the lab. During the course of the pandemic, we put that laboratory and that staff through a lot. The volume and the throughput that came because of the pandemic with all of the testing and all of the different services that were provided through the lab, it really stressed not only the staff that we have, but the building and the equipment. We have very advanced, very sensitive equipment that requires maintenance, requires service contracts, et cetera. So in developing our 25-26 budget, I asked the Public Health Lab to tell us what the needs were, and you'll see a significant request here of approximately $2.8 million for various things. In working with the governor and his staff, we wanted to determine, given the funding that was available and the tough decisions we had to make, what are the most critical short-term improvements and enhancements we needed to make at the Public Health Laboratory. And that's what you see in the governor's recommendation of a significantly reduced amount. Do I think we'll have additional needs as the months and years progress at the lab because of the upgrades that will be needed? I do, but we will work with the lab between now and the supplemental, if this request is approved, to make sure that the short-term needs are taken care of and we begin addressing the long-term, longer-term needs as well, both through, federal grant sources that are changing by the day. We know a lot of that money has fallen out of the sky and some of it has been extended, but also, through the use, if available, as a Department of Health facility, through the use of reversions if necessary, and ultimately potentially bringing back those requests in the supplemental budget. But we believe at this time, while this governor's recommendation wouldn't take care of every need that we have at the public health lab, it would be a meaningful start to the critical short-term needs that we have now. With that, Madam Chairman, again, Dr. Harris and Dr. Reed are in the audience should you have specific questions about what this would go to.
Madam Chairman.
Representative Stitt.
Director Johansson, my question is, if of the $2.8 million exception request, you get just $750,000, which of these 7 things do you plan to spend the money on? So for example, there's a $1 million maintenance agreement line item, and maintenance agreement sounds like a contract. So it sounds like you have to make the payment, but you only have $750. How does that square?
Madam Chairman, Representative Stith, I'm going to use my first lifeline and see if Dr. Reed could come join me up here. He uses words and language that I'll never understand, but trust his good judgment as our administrator there.
Madam Chairman.
Senator Anderson.
While they're looking that up, maybe mine fits in. I don't see any capital construction here in this either. So what parts fit into the capital construction?
Madam Chairman, Senator Anderson, good question. The State Building Commission recently authorized a level 1 study of the building itself. This is a combined laboratory that we share with DCI. And there, again, we experienced significant physical plant challenges, temperature regulation, et cetera, many of which we've worked with A&I to improve over the last year and a half, having chillers and air handlers installed that keep the temperature regulated where we don't have to shut down the lab. But I think longer term of where the Department of Health's lab is best suited in terms of a physical plant will be addressed through that level 1 study. So we've tried to extract most of the CapCon related items out of this request for the time being. Dr. Reed?
Madam Chairman, Representative Stiff, to answer your question, what we've done is we've reduced this list based on the governor's recommendation to maintenance on equipment that is required to keep critical operations going. So of the line item that you see, we have reduced that request down to fit with the governor's recommendation for contracts on equipment that are required to keep our operations going, such as contracts for breath alcohol testing or for blood alcohol testing.
Doctor, could you please state your full name and your title again?
Yes, no problem. I apologize. My name is Dr. Joseph Reed, and I'm the Public Health Laboratory Administrator. Thank you, Madam Chairman.
Thank you, Dr. Reed. Any additional questions for the doctor? On point? All right. Go
Madam
ahead.
Chairman, members of the committee, we are now on page 207, Unit 534, Communicable Disease. There is no exception request in that unit. On page 212, Unit 538, Chronic Disease Epidemiology and Surveillance. There is no exception request in that unit. Page 216, Unit 539, Injury and Chronic Disease Prevention. There is no exception request in that unit. Page 221, Unit 540, Infectious Disease Epidemiology. There is one exception request in this unit at the top of page 222.
Madam Chairman, I'll be brief here. Over the course of the pandemic, as I was mentioning with the additional volume and demand and requirement we had at the lab, both at the lab and our infectious disease epidemiology units, we leveraged a significant amount of temp employees. We didn't know how long the pandemic would last. We scaled up operations in a number of areas. And instead of coming to you over those 3 years and asking for full-time positions, we really leveraged temp staff. Most of that workforce during the pandemic has been reduced, temp staff significantly reducing. But when the federal government, started issuing the CARES funds and the ARPA funds, some of which last up until 2025 and 2026, we have a maintenance of workflow that continues to happen both at the lab and in our infectious disease epi unit. As an employer, I have a bit of heartburn of keeping temp staff on for 2 years, 3 years, 4 years. Can become legal issues, can become Department of Labor issues. So what we're requesting here is out of all of those temp staff that we brought on, which really were in the dozens during the pandemic, 7 AWAC positions is what we would feel are comfortable as we continue that work through these time-limited grants. And it's a no general fund cost here, but wanted to bring it to your attention as transitioning from temp staff to AWAC, is a significant change, but we wouldn't be doing this to convert them to full-time classified employees, but essentially leveraging the AWACS through the period of these various grants or programs that were set up during or post-pandemic at our lab and at our epidemiology unit.
Madam Chairman, members of the committee, on page 226, Unit 550, Substance Abuse and Tobacco Prevention, there are no exception requests in that unit. And lastly, on page 230, Unit 585, it's Women's, Infants, and Children, ARP unit. There are no exception requests in that unit. And that completes public health. We are now on to behavioral health.
Representative?
Madam Chairman, before we leave public health, could we go back to Unit 526, the public health nursing? I think it's 192, 191, 192, something like that. So with Teton County, where we pay 65%, where they leave out of where they've moved, we're now going to pay 65% of their salary in the county. We'll pay 65. The 65% that we pay Teton County is based on what we are paying nurses with the recent compensation increase. Those other public health nurses around the state that were prior to that, our reimbursement to the counties based and that goes to their nurses would be based on salaries that do not include the recent compensation adjustments. And I'm just wanting to verify that I'm seeing that accurately. And so I think as Representative Walters brought this up previously, that may be something that we want to consider. It doesn't prohibit, if I understand correctly, it doesn't prohibit the counties from doing a rate increase, but we would still only reimburse at 65% as they're currently funded. And so it may be a prudent consideration that we put forward to bring those up equally across the public health. Is that fair?
Madam Chairman, Representative Larson, the answer to your question is yes. We had this discussion with the governor. Ultimately, it's a legislative decision, so you don't see it in our budget request, but you essentially have 3 counties that are independent county nursing models that did not benefit from the recent employee compensation adjustments that happened for state public health nurses. We provided the figures of what it would take, and backing up, you're right. Teton County going independent just earlier this year happened after the state employee compensation changes occurred. So they essentially had that level set with what state employees, state nurses would make. We have 3 counties, Natrona, Sweetwater, and Laramie, where we were asked to provide those numbers, I believe for draft legislation, but also for your awareness of what it would take on a biennium basis to equalize that reimbursement from the state with what the state employee compensation package had. For Natrona, that was a little over 175,000. For Sweetwater, a little over 50,000. And for Laramie, a little over 161,000. For a total biennial cost of $387,464. So we're happy to provide that. I think the LSO has it. If not, happy to provide that to the committee, whether that would be budget action or a bill that would work its way through the legislature. But your description is accurate. That's how the split works. And Our independent counties are essentially capped at what we've put into our 600 series contract with that local office.
Also, Madam Chairman, John, does that need to go be codified, or can it be how do we?
Mr. Richards?
Madam Chairman, Representative Larson, it does need to be codified, and in fact, there's a bill before you that will be heard after the agency is finished.
There we go.
So Madam Chair,
Co-chairman?
when we mark up the bill, I would suggest that we also have a budget amendment to do it. So that if the bill doesn't get 40 votes, that we can at least accommodate those until to the general session. Just as a reminder though. Thank you.
Madam Chairman.
Probably should get some type of consensus about those efforts. Representative Walters?
Thank you, Madam Chairman. Just for clarification, that 65-35 split essentially freezes the county in time from when they move into that model. And so then, because that's when the 600 series is established. So if you did it in 2016, it would be held at that level versus doing it in 2018 or 2023 as Teton County did. Is that a proper description?
Madam Chairman, Representative Walters, yes.
Madam Chairman.
Senator Anderson?
Mr. Director, I heard you say Natrona, Sweetwater, and Laramie. Isn't Campbell County, aren't they private also? Do we consider them, or are they?
Madam Chairman, Senator Anderson, I'll defer to my Public Health Division Senior Administrator, Stephanie Pyle.
Welcome. If you could state your name.
Good morning, Madam Chairman, committee members. My name is Stephanie Pyle, and I'm the Senior Administrator of the Public Health Division. Senator Anderson, to answer your question, Campbell County does not receive funding for public health nursing services, but we do provide funding in other areas.
Senator Anderson is from both Campbell and Natrona counties.
And Johnson.
And Johnson.
Buckaroo.
Buckaroo. Additional questions concerning public health nurses? Thank you.
Madam Chairman, members of the committee, we are starting the behavioral health unit on page 234, or I'm sorry, the behavioral health division. Page 234, unit 2501, which is the behavioral health administration unit. There is one exception request in this unit on the top of page 235.
Madam Chairman, as we discussed a few minutes ago, we have a position that moved from the Public Health Division to the Behavioral Health Division, which is essentially our coordinator for the 24/7 988 Suicide Lifeline. That position, as you might recall, was funded with ARPA funds, which last us until, I believe, briefly into 2025. So this would change that funding source from ARPA to general fund, given that that funding source is expiring. So we're making that request. Again, you saw a reduction on the public health side because this position was originally in the Public Health Division, but I do believe it's prudent to change that since the state has elected to keep the 988 Lifeline going, and we'll talk about a budget request for its operations shortly. This position, it makes sense to me to convert that from a one-time funding source in ARPA to a sustainable source in general fund.
Madam Chairman, members of the committee, on page 239, unit 2502 recovery supports. There's no exception request in that unit. And on page 243, unit 2503 court supervised treatment. I think we probably should mention what's happening there.
Madam Chairman, members of the committee, as you recall, there was legislation last year that moved the court supervised treatment, or what we affectionately refer to as the drug courts, from the Department of Health to the Supreme Court. And that transition will take place in this next biennium, 25-26. So this program will no longer be in the Department of Health. The budget, all of the budget mechanisms will occur prior to July 1, including the transition of a position from the Department of Health over to the Supreme Court. Between myself, Matt Petrie, and the Behavioral Health Division and his staff, we've worked hand in hand with Chief Justice Fox and her folks to ensure that this transition is as smooth as possible. But rather than have exception requests for the reduction, I believe that's all taking place in reconciliation upon the completion of the budget. So just as an FYI, this program will no longer exist in the Department of Health and will instead be governed and managed by the Supreme Court.
Madam Chairman, members of the committee, page 246, Unit 2505, which is our Wyoming State Hospital. We have 4 exception requests in this division, and the first one starts on page 248.
Madam Chairman, page 248. This is a small request for an electronic medical record upgrade at the state hospital that we are looking to make. This would be $350,000 of general fund, and it would be a one-time expense. We do have a budget for the ongoing maintenance of our current electronic medical record, but it's in need of replacing given the new mission of the facility and what we're trying to scale with an increased census and population there. So this would be a one-time expense of $350,000 to upgrade our EMR electronic medical record at the hospital.
Representative Larson.
Would you jump back one, please, and catch priority 17?
Yeah, you have unfunded positions.
I apologize, Madam Chairman.
big one.
Representative Larson,
A little-
I skipped over a big one. Forget the EMR. Let's talk about people. So we do have a request on the top of page 248 for unfunded positions at the Wyoming State Hospital. This, you might recall, when we built and turned on the new facility, we had a staffing request with this committee and worked with you all to partner on how that request would be filled or would be fulfilled. The majority of that was funded. There were several positions at the state hospital, mostly these, that we know when we operate the state hospital and the Life Resource Center at full capacity, we will save money on Title 25 and external medical costs for the clients that traditionally, historically have been at the state hospital. I'll be the first to tell you, unfortunately, we're not there yet. Our really challenging staffing issues over the past couple of years, our extreme vacancy rates on the nursing and the CNA side have prevented at the state hospital and the Life Resource Center operating at full capacity. But with the changes that I mentioned, the state employee compensation changes, working with A&I, we are making improvements. We are seeing additional applications. We have opened another cottage at the Life Resource Center just recently. This will ultimately, I think, pan out where we'll see those efficiencies. But for the time being, we need these positions funded at the state hospital. So you'll see it's approximately, it's 31 positions at approximately $5.8 million. Governor has recommended approval of this exception request. And again, Madam Chairman, apologies for skipping over a relatively large one, but happy to answer any questions.
Chairman.
Representative Walters.
Thank you, Madam Chairman. This may be for Kevin. We've seen it throughout the budget. The governor's recommendation stating that further recommending using reversions and not authorizing or without authorized expenditure. And one of the big ones is this priority 17 to pay for these funds. And yet in the priority 17 governor's rec, it says pay for it with general funds. So I'm confused in that in many instances, he's wanting to use the reversions to pay for it, he's stating, and then when it gets to the actual request, he says general fund. So please help me reconcile the ask and the differences.
Director Hibbard.
Madam Chair, there is a request in here that we recommended that we would use reversions on. This request relates to 31 positions, and I agree with you that in the past, that was exactly what drove the standard budget flexibility that's provided to the Department of Health. It's the facility positions. And once the facilities are up and running, we're hopeful that the savings in Title 25, for example, will help us balance the budget. So in this request, we had large conversations back and forth about the 31 positions, and the choice was made to fund these 31 positions directly, but we still anticipate some reversions. But I said earlier in testimony, not today, but the previous testimony, it was the FMAP that really created the opportunity for us to be able to have reversions, plus the transition to the state facilities, which has not been completed. But hopefully when we are complete with the transition of the state facility, we will enjoy the rewards of that facility. An example would be less pressure on Title 25. I still believe that the Department of Health, when they're finished with this year and into next year, they will still struggle with Title 25. So we would still like to have that provision in the standard budget.
Co-chairman?
So Stefan, how many positions are actually short at the state hospital? I mean, and what's the realistic capability of hiring 31 new positions there?
I have that same question too, Director. So how many employees overall, how many of these employees, it is indicated primarily nurses. Can Evanston really provide that type of workforce that evidently the state hospital requires?
Madam Chairman and Co-Chairman Nicholas, yes, we can hire every one of them and we will work to do that. It has been a challenge. Overall, we employ around 350 staff at the state hospital across all different position types. We can get you a breakdown of filled and unfilled positions by type at currently, point in time at the state hospital. I will mention, Co-Chairman Nicholas, many of these 31 positions are filled today. We have the positions. It's just the funding source was not there or was on a one-time basis.
So what's your current vacancies?
Current vacancies at the state hospital across the board. I'd have to get you that. I mentioned a high that we saw in nurse vacancy rate about a year ago of over 60%. That has improved, but I'd have to get you a breakdown. We're happy to provide that to the committee.
Thank you.
Director, not that you would know this, and this is pretty extensive, but I would be curious to know as it relates to our higher education funding, how much of that workforce in nursing at the state hospital, where those nurses are educated. Is it out of Utah or is it out of a Wyoming school?
Madam Chairman, that's a great question and information I would like to have as well. I don't know off the top of my head. Let me work with Behavioral Health Division in the state hospital to see if we can maybe do a brief survey or at least feedback from management at the hospital on estimates of where folks receive that education. It's a mixed bag. Again, we do pull a lot from the Salt Lake area, given its proximity to Evanston, but we certainly have nurses and CNAs who completed their education and coursework certifications in the Wyoming Community College system. So we'll have to see what we can do on that question, but it's a good one.
So, madam, follow-up question. So what's the turnaround time currently if you have a psych eval or competency eval at the Wyoming State Hospital?
I'm not sure you should answer that question.
Madam Chairman, Co-Chairman Nicholas, on Title VII, again, state hospital is split between civil, typically Title 25, and Title VII, criminal forensic services. On our forensic evaluations for Title VII, our outpatient forensic evaluations we're turning around in about 30 to 45 days, which is good. Outpatient is very much easier for us to do either in person at the detention center or via telehealth. Inpatient evaluations and inpatient admissions on the Title VII side, both for forensic evaluations and for restoration services when someone is found to be incompetent to stand trial and then ordered for inpatient services. That wait time to admit is much longer, between 5 and 7 months currently. We're not as high as California at 3 years, but we're not where we want to be, and we're working to really reduce that. Again, Life Resource Center is a big part of this equation and decompressing the state hospital, mostly on the civil side, but it has a bleed over effect to the forensic side, and through initiatives that we've worked with the Supreme Court on with Chief Justice Fox. They're actually up in Campbell County today doing a formal signing of a diversion program that's starting in the early part of next year to essentially take misdemeanor, extremely behavioral health intensive patients and divert them from the Title VII process into community care. It's a really great thing that they're celebrating today in Gillette. where the local community has come together to divert those folks out of the criminal justice system. In addition to that, we're trying to contract for telepsychiatry services that we can provide to interested jails and detention centers to provide medication and stabilization while that wait time is taking place for inpatient admission. When stabilization can happen, folks can move more quickly through the judicial system or even discharge. So again, on the inpatient admission side for Title VII, much longer than we want it to be. We need to work on improving that. And on the wait time for Title 25, I'd have to get you that number. It's been better.
How much is that waiting list a component of your staffing or understaffing?
Madam Chairman, Co-Chairman Nicholas, it's a big component of it because our low staffing levels have equated to us not being able to operate at full census. I double check with the folks sitting behind me, but over the past year, we've been operating in the 70s in census at the state hospital. Might be a little bit higher, but our bed capacity there is 104 beds, as you know. We want to get to that full capacity, and a lot of that depends on the availability of nurses and CNAs. Again, with some of the changes that have gone into effect this past July, and with the partnership that we've had with A&I that's supporting us in looking at nurse and CNA wages, being able to have flexibility on certain things, we're seeing progress at both, at all of my facilities, frankly, but it's a continuing challenge.
So another follow-up question, Madam Co-Chair. So my understanding is that the Laramie town of City of Cheyenne requested a couple of evaluations. And and basically, I think they may still be waiting to get those evaluations done, 6 or 7 months, just for an evaluation. Do we have that problem in hand?
There's more to that story.
Madam Chairman, Co-Chairman Nicholas, without getting into the patient-specific details, yes, I'm very well aware of that incident. It's interesting because municipal code violations resulting in Title VII orders was a new thing for us about a year and a half ago. So probably a little bit of delay on that, just determining legally what our role and responsibility was. That particular case that you're talking about, I believe, is our next client up for admission. But again, inpatient admissions on the Title VII unit at the state hospital are seeing a significant wait time by nature of our capacity there.
Thank you.
Are you now handling municipal code violations that are now going into the state hospital to see if they're competent to stand trial for a traffic ticket?
Oh, boy. Madam Chairman, yes, we have received orders of those kinds in the past 1 to 2 years, yes.
From magistrates?
Madam Chairman, yes.
And Madam Chair, it has to do with whether or not there's substantial jail time. So they have an obligation to do it. It's a constitutional right in a sense. So it's just a.
Madam Chairman, the state hospital and my staff, that we are here to serve our communities and our courts and our judicial partners. We will do everything to that end. But yes, there's nuance with orders like that, but also I think one of the things that's been exciting to work on in partnership with the judiciary is looking at what the best value for the limited capacity of the state hospital is. The judiciary has been very good with us in the past 1 to 2 years on minimizing evaluations on an inpatient basis for misdemeanors. We should not be doing that. It takes too long, and we provide high quality forensic evaluations on an outpatient basis that are as good as bringing someone into the hospital, period, full stop. But there's been a historical reticence that you're going to get better service if you go into the state hospital on an inpatient basis, both with the evaluation and because now the client's already there if we need to order restoration, if that makes sense. Both for misdemeanors and felonies, I do think the best use of the resource with our contracted forensic psychologist is to leverage as much outpatient evaluation and telehealth that we can to make that system more efficient. Inpatient orders for restorative services and for not guilty by reason of mental illness clients, absolutely, that's state hospital role to admit those clients as quickly as possible inpatient. And that's where we get into capacity issues with staffing that have resulted in some longer wait times than we like.
Representative Larson?
Madam Chair, a couple of questions, and I think maybe the nuance on this conversation was perhaps that instead of ordering for an evaluation, it was ordered to be inpatient. And outpatient evaluation perhaps could have happened at a quicker speed, but inpatient was different. And Madam Chairman, and I want to ask, so if we go to the vacancies, the branch vacancies, and we see your agency, we see a number of these that are frozen for funding purposes. Are those the 31 that you're seeking funding for?
Madam Chairman, Representative Larson, yes, some of them are.
So we have access to that now.
Yes.
Director, if you know, we're hearing kind of anecdotal evidence that there's an increase in Title 25 and inpatient referrals. Are you seeing that as well?
Madam Chairman, we can provide a full, we track that daily. I would provide a full breakdown, both on Title 25 and Title 7 for the committee. Memory serves, our Title 25 volume is relatively static on a month-to-month basis over the past couple of years. Our biggest growth was in volume was 2015, 2016. Our costs have increased. A lot of that's related to our capacity at the state hospital, but we can provide that to the committee.
And one final question, Director, about these local municipal magistrates ordering people to the state hospital. Is the department seeking reimbursement from these municipalities for those costs? For example, the circuit court and the district courts, which are the other courts within the state that may order a patient to inpatient treatment, those are state courts. But a municipal court is a fully funded entity of the municipality, typically led by a magistrate. And so did you seek reimbursement for those costs? And if so, will you?
Madam Chairman, no, we did not, and had not planned to. The volume is low, but we can revisit that issue.
I highly suggest that you do, and that might deter that behavior.
Thank you, Madam Chairman.
Thank you.
Moving on, Madam Chairman, the bottom of page 249, priority number 36, is our Title 25 request. Nice segue from that previous discussion. We requested 7 million. Right now, our standard budget in Title 25 is 6 million on the biennium. We are operating biennially at a steady state of around 12 to 13 million currently in our biennial cost. Again, we believe this will come down over time when the facilities operate at full steam. We requested 7 million. You'll see the governor is recommending 3 million of this. I think that's fair and okay because we need to, with our facilities having more staff coming online, I think our census at the hospital and the Life Resource Center will grow. This is prudent to look at this next fiscal year and come back in the supplemental and see what that balance would be. So the governor's recommend 3 million of our total $7 million request. Madam Chairman, members of the committee, page 250 going into page 251.
Madam Chairman, before we leave that behavioral health Title 25, the governor's rec, again, 3 million, denying the 4 million, but then we go back to his other comments in many of these other other divisions where he said he wants to fund Title 25 with reversions, for abbreviating his long title. So then the question for Kevin is why 3 million general funds and why not fund the difference with the reversions versus the outright denial of the difference of page 250, the governor's rec is where I'm referencing.
Madam Chairman, while Kevin's looking at that, Representative Walters, if I may, again, I think we have $6 million in the standard budget for Title 25 now. So in the first fiscal year, in fiscal year 25, if the governor's recommended $3 million were approved by the legislature, we likely will not spend that full balance of what's in the budget in the first fiscal year. So rather than authorizing $3 million and then the balance of our request, $4 million in reversions, I think we can revisit that in the supplemental to see if we're trending in the same direction versus funding it all in standard budget currently. And Director Hibbert, if I misspoke, please correct me.
Madam Chair, Representative Walters, does that satisfy your question? Thank you.
Madam Chairman, bottom of page 250, going into page 251. This is a no general fund exception request in our permanent land fund at the Wyoming State Hospital. We bring these sometimes every session or every biennium. Permanent land fund we have generally funds things like furnishings, vehicle repairs, vehicle upgrades, in this case, some medical lab equipment and shop equipment in our state hospital fleet.
Madam Chairman, members of the committee, now on page 259, Unit 2506, outpatient mental health. There are 3 exception requests in this unit. The first one on the bottom of page 259.
Madam Chairman, members of the committee, bottom of page 259 is priorities number 41 and 42. This is operational funding for the 988 Suicide Lifeline, as well as additional text and chat capabilities. Happy to talk about both here. As I mentioned in my introductory comments, we have stood up the 24/7 Suicide Lifeline that's Wyoming-based. It's been operational for about 1.5 years, and we have 2 contracted call centers, one in Casper and one in Grable. Currently, the Lifeline operations are funded with time-limited federal funds that really expire in the spring of 2025. We are requesting in our general fund budget the ongoing operations for the Lifeline that you see outlined on page 260. In addition, we have requested a general fund for the addition of text and chat capabilities in the Lifeline, which we estimated a cost of approximately $774,000. These requests together will keep our 24/7 Lifeline going and do that through the standard budget. I understand the legislature has considered, a bill with a trust fund in it for long-term operations of the Suicide Lifeline. Absent that policy decision of funding a trust fund like that, we will continue to discuss it in our standard budget here. You'll see the operational costs for the Lifeline are one request, and the addition of text and chat capabilities is split out in a separate line item there. I'll close and say I think the implementation of the Lifeline has been successful in 2 ways. The operational data and metrics we get when we stood that up, the speed to answer is very good. You've heard the governor talk about this. I think it's been a success story so far that Wyoming-based people are answering these calls and referring to other Wyoming-based service providers, et cetera. Our data looks good operationally compared to how the calls would have routed to the national call center, which had a longer speed to answer and just worse, lower quality operational metrics. In addition to that, probably can't draw a straight line here, but we have seen or detected statistically the potential of a flattening of our suicide rate, which since 2005 has really been on a linear increase. We study that very rigorously across multiple divisions and in my office, and so I don't want to overpromise and say, our suicide rate is going down, but we have seen and detected a potential flattening, which points to some of the successes of programs like this potentially, and other programs that have been invested in on the mental health side. So with that, happy to answer any questions about this request for 988.
Senator Anderson?
Madam Chairman, there's 2 different dollar amounts, one probably in Grable and one in Casper. Could this be a contractor in any small town in Wyoming? How do they qualify? Is there a onerous thing to qualify, or can they do that pretty easily?
Madam Chairman, Senator Anderson, so when we were directed to stand up the 24/7 Lifeline, we put an RFP out, which had qualifications, both from the state, and because this is the 988 system, which is national, there are certain national benchmarks and requirements that have to be met. We were not sure how many bids we received, but ultimately we wanted the ability to have multiple awards so that we knew we had 2 call centers in different parts of the state, and we awarded 2 separate contracts who must adhere to the same standards, both state and federal. but essentially operate in concert and cover the hours, have essentially worked together, partnered to cover the hours. So we have 24/7 coverage, and that's split between the two providers.
Mr. Co-Chairman?
Thank you. A couple different things, Stefan. Does the funding require regular reports to labor and to us in terms of your assessments and the data supporting those assessments?
Madam Chair, Mr. Co-Chair, I don't remember off the top of my head if any bills or authorization that passed had a reporting requirement. I have to double check with my staff on that.
So
We're happy to do it.
yeah, I'm just saying that if you could provide some of that data to us so we can actually see what you're referring to and what's the hard numbers you're relying on for your representation. And then my next question is, it's hard to believe that there aren't significant grants out there somewhere to help cover part of this cost or expand the program. And have you actively delved into that realm?
Madam Chairman, Mr. Co-Chair, we have. Right now, I'm not aware of any that would be, full support for the operations or these additional functions. But you're right, the situation changes month to month with what the federal government through their agencies or SAMHSA releases. We will absolutely, update the committee and the legislature if those funding sources become available to fund operations. Right now, I'm not aware of any, but it could change.
That could be Kevin's new job.
Director Hibbert, if you'd like to respond.
Before that response was completed, I'd already sent an email in to put that on our priority list with our vendor to research that.
Director, you indicated that across your agencies, you're paying close attention to these suicide numbers and you feel like they're flattening potentially. Is that true? Potentially flattening?
Is that a yes?
Potentially. I think you were hopeful that they're going to start to flatten.
Madam Chairman, early indications that may be the case.
Are you aware through any of the Department of Health efforts or through the university or any other entity in Wyoming that's actually doing any kind of peer-reviewed academic or medical research associated as to the why instead of as to the response?
Madam Chairman, it's something we've talked about often with more of an epidemiological review, post hoc review of suicidality. That's not something that's happening in my department full bore. I'm not saying there aren't efforts going on to address it. I would be naive on private sector academic efforts there. Perhaps Dr. Harris might have some information, but we can look into it and get back to you.
I'm not aware of any and just was curious as we constantly, have struggled with this for decades and decades. Wyoming's efforts to understand more of the why instead of the anecdotal explanations of wind and cowboy culture, which I personally find a bit unpersuasive and more curious about digging down deeper. I know additional research has come out that there's some genetic DNA components associated with a predisposition to it, but I do think if we can understand the why, we can help provide better solutions. And I support the hotline, but I'm not sure it's going to, it's a resource, but it's not going to move the needle in a significant way. Dr. Harris?
Thank you, Madam Chairman. My name is Dr. Allie Harris. I'm the State Health Officer at the Wyoming Department of Health. Agree there's something like a statewide suicide review is not happening at the moment to really sort of dig down deeper into the causes. I believe there are some local efforts towards that. However, at the Department of Health and the Public Health Division, we do something called the Violent Death Review, where we look into all both suicides and homicides that occur in Wyoming, and again, go beyond the death certificate, law enforcement reports, coroner reports, medical reports to again, kind of get a little deeper, but agree that, kind of a statewide effort to really understand what is happening is probably not happening in a unified way.
And doctor, just as I put this out there, and I don't know that this necessarily belongs with the Department of Health, but just as a conversation statewide, I know that Wyoming is within the suicide belt of the Rocky Mountain region. And so certainly this is not a problem unique to our state, but is a regional challenge. And so any of those efforts really need to be within the Rocky Mountain region because it's a a similar challenge. So that's my comment.
Madam Chairman,
Representative Stiff?
Director Johansson and Dr. Harris, perhaps also too, following up on that line of questioning, in Senate File 66, we appropriated $5 million for an innovation fund. I know applications have come in for that. My question is any of that innovation funding being used to look at different ways of addressing the suicide issue? So for example, it's my understanding that chronic hypoxia is positively correlated with suicide risk. And so what causes that are things like smoking, COPD, and living at high altitude, right? So it's possible that, that's one of our root causes. And would it be worth using any of that innovation funding to addressing that potential cause?
I think that good research came out of the University of Utah, Representative Stiff, who I know has taken this issue very seriously in understanding those causes. I'm hopeful Wyoming can partner in that way. But Director?
Madam Chairman, Representative Stiff, David Robinson will slap me on the shoulder if I get this wrong. I do not believe we received any innovation of our ARPA innovation grants applications for anything related to that or suicide. We did deploy some of the innovation money to a few applicants, but none, to my recollection, were in that area.
Madam Chairman, as a
Follow-up?
follow-up, so of that $5 million, how much is still left? I had the impression that there was still some of that money that had not yet been obligated.
Director?
I'm sorry, Representative Stiff, looking for my lifeline. I missed your question. Could you restate it, please?
Madam Chairman, the question is, I thought that there was some portion of that $5 million of the innovation fund that had not yet been obligated.
Madam Chairman, that's correct. I don't believe the balance of that $5 million was used entirely. Some of that was denials based on ARPA eligibility, et cetera. Madam Chairman, we anticipate 1.8 million of that 5 million is likely to be reverted, unused.
Madam Chair,
Director Hibbert?
if you haven't already received it, you will, and that would be the ARPA redeployment letter. Those statistics for the streamlined ARPA would be included in the body of that message. So I'll look into it for you and get a direct answer, but it's been memoed to you.
All right, thank you. With that, we might wrap this topic up and then break for lunch. I know you'd hope to be done before lunch, but that's not going to happen. So any final comments on this particular section, this unit? Any final questions on this unit before we come back for lunch?
So, Madam Chair, you got an estimate? Can we finish it in 20 minutes? No?
Madam Chairman, I think we could be close. We have a few big ones, but as we get closer to the back of the book here, it does rapidly speed up.
Okay.
We have plenty of time for you on the agenda. So I know you'd hope to be done. Well,
We are here at your discretion, Madam Chairman. If you'd like to keep everybody here, we're happy to slog through it.
all right, with that, we're going to break for lunch and we'll come back at 1:08. Or we'll make it 1:10. 1:10, you get an extra 2 minutes. I know.